Right. Good afternoon, everyone. I'll be muting everyone and making you serially the co-host. We're good to go. We're also live on YouTube now, admitting all the participants as well. Good luck.
Good afternoon.
Good afternoon, sir. Good afternoon, everyone, and a warm welcome on behalf of UNICEF Hyderabad Field Office, Indian Academy of Pediatrics, the Twin Cities branch, and the Indian Academy of Pediatrics, the Telangana State chapter. And also greetings on behalf of the co-organizers today, the Trained Nurses Association of India, the Telangana State chapter, and the Apollo College of Nursing. We welcome you to today's International Nurses webinar as part of our World Breastfeeding Week 2021 celebrations. Thank you all for joining in, and I promise you a wonderful academic feast ahead. To begin with, may I now request Dr. Pavan, please give his inaugural remarks. Dr. Pavan is the Secretary of IAP Telangana State. Pavan, please.
Yeah, hi. Thank you, RSV. This is really a wonderful program today we are going to have, eagerly waiting since morning. This World Breastfeeding Week celebrations are going to be a really, since past 50 years, more than 50 years, we are all doing these programs and all. But now I think this year, let us come into action and what is the bridges, what is the gaps which can be bridged, that can be discussed now. I think if, as per the WHO, more than 8 lakhs child lives can be saved. If we just follow, which is a very cheap, it doesn't cost anything. Almost 8 lakh child lives can be saved. So that is the power of breastfeeding. So we all came together today, IAP, TCB, PATS and nursing associations and all. So today we are going to have a very fantastic event. So I wish all the best for the entire program. Over to you, RSV.
Thank you, Pavan. May I now request Dr. Arjun, the President of IAP Twin Cities branch, for his inaugural remarks.
Good afternoon, everyone. And it's very happy to know that UNICEF, PATS, and all other stakeholders are Apollo College of Nursing, all are doing this World Breastfeeding Week celebrations. You know very well, the breastfeeding is the first and the most effective vaccine for a child. I call it as a natural vaccine for the newborn child. The first 6 months are protected only because of breastfeeding, and I always feel breastfeeding or mother's feeding is the right of every newborn, and it is a duty of the treating nurse, pediatrician, the obstetrician, the entire team of the family. They should ensure that every newborn is breastfed exclusively up to 6 months, starting from the first hour of life. In this regard, we know the role of a nurse because she gives the hands-on training to the young mother, and she's the one who constantly observes mother and baby. So it is imperative that we train them very well, very effectively, very properly. And also we have to get a commitment from them, pledge from the treating nurse to see that the breastfeeding is initiated within the first hour, and also it is sustained and continued. So they play a very important role, and so it is so happy that the nursing college is cooperating, and also the Apollo is collaborating with PATS, and now UNICEF is also joined hands to do this wonderful program, and wish the program all the best for the deliberations ahead. I'm very committed and I'm very passionate. In fact, when I gave my All India Radio talk, I said, I'm so emotional about promoting this day in and out. And my heart pains a lot when I see children these days are bottle fed even beyond 6 years of life, such a pathetic state. So we cannot overemphasize the importance of breastfeeding in this regard. Go ahead, I don't want to stand in the middle of the proceedings. Go on.
Thank you, Dr. Arjun. May I now request Dr. Suren Nath, the President of IAP Telangana State Chapter, to please give his inaugural remarks.
Thank you, Sri Krishna. On behalf of Pediatric Academy of Telangana State, we invite all the stakeholders of today's webinar. And it is a part of 1 week celebration of Breastfeeding Week from 1st August to the 7th August. And we are happy to be associated with UNICEF and Telangana Nurses Association, at the same time Apollo Nursing College. And not only that, stalwarts from all over the world have been brought to today's webinar. We hope that we'll have a good time and good learning things will be learned today. In fact, breastfeeding is one of the basis of development of the child. Early childhood development depends on the breastfeeding. We all know that. And we all know how important is the breastfeeding to continue at least for 6 months. But unfortunately, the practice is still only 60% of the mothers are able to feed exclusive breast milk during the first 6 months. So all these deliberations are going to help to increase these percentages. And I hope today's webinar will be a successful one. Thank you. Thank you.
Thank you, Dr. Surendra. Again, take the opportunity to thank both the executive boards of IAP Twin Cities and the Telangana State Chapter for a wonderful World Breastfeeding Week celebrations through the entire weekend. We are just midway through the week and there's been a lot of activity. And this is one of the major activities, the International Nurses Webinar. I now have the pleasure to thank and also acknowledge the presence of Rati Balchandran. She is the I thank Dr. Rati Balchandran, the Assistant Director General Nursing at Ministry of Health and Family Welfare, Government of India. Thank you, ma'am. Thank you for sparing your time amidst a lot of activities there at Ministry as well. We look forward to your theme address. Over to Rati, ma'am.
Thank you. And the team from Telangana, the organizers I appreciate the organizers for bringing the stakeholders together and also celebrating this for the nurses webinar, International Nurses Webinar. As the theme itself is mentioning about the supporting breastfeeding. As it is told by the theme itself is mentioning about supporting the mother, and breastfeeding as breast milk is the first vaccine and the most cheapest one which is to be provided. Is the fundamental right of the baby and the responsibility of the mother to provide breast milk within the first hour, and it protects the baby from all infections, as well as it helps in development of brain and the overall growth and development of the baby. So as nurses, it is our responsibility to educate and support the mothers to go through the stages, and so that they will be able to initiate breastfeeding right in the first hour itself, and also preparing the mother to have adequate breast milk by taking balanced diet is also an important thing. The preparation of the mother about the importance of breastfeeding to be started during antenatal period itself, so that the mother should be hand-holded to initiate breastfeeding within that 1 hour, and how important it is, what are the health benefits for the baby by providing breast milk, and what will be the benefits of breastfeeding is throughout the life of the baby. So that has to be empowered. And as mentioned, that we are the only people, human beings are the only people who are giving something other than the breast milk to the babies. So we should also pledge that we will the human beings, we will ensure that every mother will be giving to the babies within the 1 hour, and will continue for the 6 months for better development of the babies. As it is an investment for the future of the country, let us pledge that we will reduce the gap of the delay in initiation of breast milk. For example, there are more than 40% of babies are not getting this, and especially in the cases where the cesarean section is there, or if we see the survey, the number, the percentage of breastfeeding within 1 hour has reduced in around 12 states. So it's an alarm for us as nurses. It is our responsibility to close this gap, so by educating the mother and be an advocate for the mother and baby to ensure that breastfeeding is initiated within 1 hour. Help the mother to sustain breastfeeding at least for 6 months, so that the babies will be healthy. That's the cheapest and the easiest method of preventing infections and preventing deaths. As nurses who are there for 24 into 7, 365 days, close in the hospital, they are the persons who are with the mother soon after in the labor room as well as in the neonatal wards. They have to ensure that the babies are getting breast milk. If not initiated by the natural method, there are few programs also initiated by Government of India, like MA program, breast milk bank. So like those things are also there to facilitate the advantage of breast milk to the babies who are challenged, or there are difficulties in getting natural breast milk. We have to also look into the social factors which are affecting in breastfeeding, be it in the when the mothers going for the work, or when they're traveling, wherever the challenges are there. We have to ensure that the facilities to handle these challenges by having breastfeeding rooms available or such facilities to the mothers. I congratulate the team and also the Telangana. Telangana is a state which is taking ahead in be it the midwifery initiatives or even the data are showing that breastfeeding is much better in Telangana over years. So I congratulate the team for coming together and a collaborative effort for advocacy of breastfeeding. And I wish that this webinar will be a useful thing for all the people who are attending. Thank you very much for inviting me to be a part of this.
Thank you, Rati ma'am. And Telangana has always been a team of nurses and also the doctors, both in the SNCUs, the NICUs, the labor rooms, and across all the domains in healthcare. And we have huge respect and acknowledge the contribution of nurses. And we've seen it in the last 1.5 years of COVID pandemic, where they have taken maximum care of the patients, and huge respect for the entire nursing community. Thank you, Rati ma'am. Thank you for driving this at the national level as well, and highly appreciate you taking your time out to address the nurses of Telangana state. I now invite Dr. Sanjeev Upadhyay, the health specialist, UNICEF Hyderabad Field Office, to give his address. Dr. Sanjeev, please.
Thank you, Dr. Sri Krishna, and also thanks, Dr. Rati, for your spending time with us. Let me just start with telling that the whole midwifery initiative of Telangana actually started with breastfeeding only. When NFHS 4 results came and we were analyzing the early initiation of breastfeeding rates across states, and there we found that Telangana has very low early initiation of breastfeeding rates. And when we dwelled deep into that, and there we found that no, it's not just because of some low awareness amongst people, but also one of the reasons cited by a lot of experts was high C-section rate, and that is how we came with the solution that can midwifery be a game changer. So that's how it started. So good that we have now midwifery a reality in our state now, and I really congratulate state government for their commitment for midwifery. Despite of lot of bottlenecks, state is moving smoothly on now midwifery. And another point I just want to share with all of you, and when I was doing my graduation and when I was in medical school, I always used to think, what is so big deal about breastfeeding and why it is so low? And every year we used to have this World Breastfeeding Week, and there used to be a symposium for all medical students in my medical college. And that was in back of my mind. And then after coming to my professional life as a public health specialist, there I again found that yes, if we have a right kind of people in place, we can improve it. But now after spending so many years, I feel that it is not so easy the way I used to think earlier. This requires a lot of commitment from different stakeholders. That's how I'm really impressed with this year's theme, which says that protect breastfeeding, a shared responsibility. We require everybody's participation in this, and that's why I again congratulate organizers bringing our nursing colleagues in this event, especially organizing it for them. They play a very major role, and when I say nursing colleagues, it's not just staff nurses. I actually would like to even include our auxiliary nurse midwives, our professional midwives, and even ashas, because all of them, because that's the kind of ecosystem we require to make a real big dent in breastfeeding rates. In Telangana, in spite of lot of efforts in last 5 years, I can say between NFHS 4 and NFHS 5, there is hardly any improvement in early initiation breastfeeding rate. It is almost static. Now, there is a need that we should have a combined effort, a joint effort, where not only doctors, not only nursing professionals, not only paramedics, but we need to pull others as well. The whole Department of Women and Child Development, WCD, our Anganwadi worker, because in field they play a major role when they talk to mothers, pregnant mothers, lactating mothers, and we want everyone to be part of. Not sure if our ICDS colleagues are there on this presentation with this webinar today, but I'm sure at least excerpts of this international webinar can be shared with Department of Women and Child Development. I'm sure if there are good messages, they would certainly like it. So that's just a few comments from my end. I'll say that breastfeeding is improving breastfeeding is not very easy, it's tough, and it has become tougher during COVID times. A lot of multinationals, they are trying to promote, especially those who are in milk food business, they are trying to promote their products in the name of COVID, commenting that breastfeeding may lead to infection amongst babies. I think this is something which all of us should shun and should make sure that whether it's a COVID or non-COVID, our breastfeeding rates don't come down. Lot of interesting people I know from the state of Telangana, especially from public sector, starting last year, in spite of having very limited information in the beginning, they did not stop kangaroo mother care, which is also kind of extension of breastfeeding, and other breastfeeding related activities within their facility. So efforts are not enough in facilities. We require also efforts in community. Whenever it comes to Telangana's low early initiation of breastfeeding rates, or even exclusive breastfeeding rates till 6 months of age. My concern is why it is so low. When we know almost 100% women in our state, they deliver in the health facility, be it private or a public. And this I see as a missed opportunity. When women stays with us for at least for 24 hours, and at times even 4 to 5 days, if we are not able to convince them to breastfeed their child immediately or exclusively for 6 months and continue at least for 2 years, I think we fail in our duty. So thank you, organizers, and I'm sure all the participants, especially my nursing colleagues, they will take note of it, that whenever and wherever they get opportunity, whether you are posted in labor room, or you are posted in a gynae ward, or you are posted in any other ward of the hospital, or in any of your interactions, please don't miss this opportunity to convey this message to people, to community, to society at large, that why breastfeeding is so important and how we can make sure that children, they don't miss their first vaccine, that is breastfeeding, as rightly said by many speakers before me. So thank you, Dr. Sri Krishna, and thank you, Indian Academy of Pediatrics, Twin City branch, as well as Telangana State Chapter. Thank you. Over to you, Shri.
Thank you, Dr. Sanjeev. And this year, the theme itself, shared responsibility, drove the entire group of pediatricians to go beyond just us. And this week's celebration has proven that when you work as a team, we are able to garner more promise for this initiative. The launch was a very grand launch on the digital platform across the country. And then today is specifically devoted to nurses. Dr. Surendra is actually overseeing a nurses quiz. There's a nurses elocution competition, and now we have this nurses webinar. So each day we've devoted to one group of health professionals who have a very significant role. Saturday is devoted for parents, and we have wonderful activities coming up specifically for parents. We have one day, Tuesday, which was devoted only to the obstetricians, and we interacted with the obstetricians, had common webinars and a common understanding that we need to do more and do it on a sustained basis to ensure that every woman who delivers breastfeeds. Thank you, Dr. Sanjeev, for all the support from UNICEF. I also acknowledge the presence and the support of Dr. Salima, a big driving force for us at office to push the agenda on breastfeeding and get all stakeholders together. Thank you, Dr. Salima. I'll quickly now move on to the scientific session, and I welcome Dr. Vijay Kumar to take over. Dr. Vijay Kumar, you have Dr. Arakala Bhaskar, the chairperson, Dr. Vinoda, Dr. Indi, and Dr. Alimelu. And at the outset, let me tell you, it's a very interesting session. We didn't want to have just pediatricians talking. We wanted a mix of birthing counselors, pediatricians, nursing faculty, and also Indi herself. And thank you, Indi, for sparing your time and joining us. So I promise you it will be a wonderful scientific session ahead. And ending all this will be a wonderful poster, e-poster section. And my apologies to the judges for making a very tough task, giving you a tough task, because you had huge number of e-posters to judge. And it's just going to be 5 presentations and the top 3, which will get a Amazon gift voucher as a prize. So request all of you to stay on till the end. I now hand it over to Dr. Vijay Kumar to take it forward.
Good afternoon, President and Secretary Dr. Surendranath, Dr. Pawan Kumar PATS, Dr. Arjun and Sri Krishna. Sri Krishna is organizer of this function. And good afternoon, Dr. Sanjeev Upadhyay sir, Sister Rajeshwari, Sister T. Vasundhara Tulasi, who has been working in tandem for last 3-5 days. Regarding judges, sir, there is so much of homework is done that judges will find 5 minutes more, and I think that will go quite smoothly, sir. And coming to this year's topic, working with all the stakeholders over next 2.5 hours. All stakeholders are participating in this webinar, and working in a webinar, nurses webinar is actually these are the target audience, and working with RSV. RSV has been in Hyderabad and all periphery of 2-3 states, and he knows the periphery and this thing. So I'll go to this thing. We said protect breastfeeding. The protect breastfeeding word little it worries a bit, because who protects whom? The breastfeeding protects all of us. The best survival strategy we have. So some years back we used to say promotion of breastfeeding. Now we are saying this year protect breastfeeding, actually, which protects us, and let the days not come over the next few years. We say preserve breastfeeding. So this is right time for all of us to be very scientific and very community based in the approach. So next we have 3 lectures, one by Sri Krishna said, 3 different specialities. I invite Dr. Arakala Bhaskar, President-elect of PATS, who has been a practitioner in the periphery, Kottagudam, and has been involved very much with the community services regarding maternal and child care services. I request Dr. A. Bhaskar to take over as chairperson and conduct the session on the preparing mothers for breastfeeding. Over to Dr. Bhaskar.
Thank you, Dr. Vijay Kumar, and very good afternoon, all elite panelists, guardians, and protectors and promoters of the divine breastfeeding. And first of all, let me express my immense thanks to PATS President, Secretary, and PCB President and Secretary Sri Krishna and UNICEF to let me take part in this great platform. And today we are in the midst of celebrating the breastfeeding week, and throughout the state, because of our teamwork and inspiration from the leadership, it's like going like a festival, and every pediatrician and PSC and paramedical staff and other stakeholders are galvanized to do it in a great way. You know that this year's theme is a shared responsibility, breastfeeding. This highlights the link between breastfeeding and its relation with the survival, health, and well-being of women, children, and communities, and also the nations of the world. And today, our objectives are to inform the people about all the benefits of the breastfeeding, and also transmit our knowledge, our practical experience to the parents, mothers, and communities, and also give anchor support to the breastfeeding to the and make it a public health responsibility, and also engage all individuals, communities, NGOs, and including the public health authorities to make it a culture of giving every baby has its right of breastfeeding. And let's also galvanize all actions promoting and protecting the breastfeeding to improve the public health. These are themes what we have in front of us. And this breastfeeding week celebration started almost, we all know that 2 decades back. Then the statistics were around early initiation of breastfeeding is around 50%, and now is also saying 51 or 60%, and continuation or exclusive breastfeeding is only up to 60%, even now also. So where we are faltering, whom do we stimulate or convince or promote this breastfeeding, we have to think over it. And this protection of breastfeeding also, the breastfeeding protects the mankind, but also we have to protect this breastfeeding, the mothers, from the onslaught of the industry, their marketing strategies, and also some mischievous elements in the professional healthcare takers. And also we have to protect the mothers from all disbeliefs and obstacles regarding the breastfeeding. Today we have 3 elite panelists. All 3 will discuss about promoting the breastfeeding during the antenatal clinics, and also postnatal wards, and also in the community. We have 3 panelists. First one is Mrs. Inderjeet Kaur. She is a director and midwifery services, Fernandez Foundation, and she is very much passionate about reducing the maternal mortality via the midwifery training and respectable humanized care for Indian mothers. Welcome, ma'am. Next, we have Vinoda, Dr. Vinoda, birthing educator and lactation consultant from Apollo Cradle Hospital, Apollo. And she is co-founder of happymom.in, over 10 plus years experience as a lactation expert and language instructor at various hospitals. Currently, she is working as a visiting consultant from 2017 at Apollo Cradle, Jubilee and Kondapur branches. Also, she is a birth educator, clinical physiotherapist, pre and postnatal fitness expert, labor support and lactation consultant. And another distinguished panelist is our Dr. Professor Almelu, madam. She is a professor and HOD in Neonatology Department, Institute of Child Health, Nilafar Hospital, Hyderabad. And I welcome all the panelists. And the stage is for Mrs. Indrajit Kaur. Madam, please.
Thank you very much for the kind introductions. I'll share my screen.
Okay.
I would like to take this opportunity to thank the organizers of the event and, and thank you for inviting me to speak on such an important subject. Professional midwives are in a perfect position to encourage mothers to breastfeed for the known benefits, which all of you have eloquently presented. Women need to be well informed. Women need to be well informed when making decisions about feeding, and midwives are in a crucial position and responsible for providing this education and advice. It's important to empower women with the knowledge and benefits. There is a lot of myths around breastfeeding, and more so, mothers need to be prepared during the antenatal period on the importance of breastfeeding. And very often, this is sidelined. Everyone is so concerned about the whole process of birth, and breastfeeding tends to take a back seat. However, during the antenatal visits, it's important to start having these conversations at least 3 times, preparing mothers and supporting mothers that is important to breastfeed, but you're not going to do that if you don't broach the subject as early as possible. And not only that, giving them the information that breastfeeding can improve the quality of outcomes for the babies and for themselves as well. However, we need to provide environments that are sensitive, because we know that effective counseling can also help mothers to overcome these challenges. We know that there are a lot of challenges in India, and we look at our antenatal clinics. We need to start looking into how we can increase and inform mothers, and by having education classes, not only that, but also having continuity of care with the midwife will support that. So the best practice is, for first pregnancies, give them the time, ask them any questions or worries. A lot of women out there bring in preconceived ideas or what they have heard, and it needs to be set right. And this is the excellent time to do so. And we need to build up on her confidence, not just for first-time mothers, women who've had second babies. We need to ask them as well, what was a previous experience of breastfeeding? Because a lot of women share with me when they see me, they say that the birth was excellent, but my initiation towards breastfeeding, I did not think that it was going to be so difficult. So it's important to manage expectations and to inform and talk to mothers as early as possible. Examine her breast if she has concerns. And it's also very, very family orientated in India. So it's important to also educate the family at the same time. What we tell mothers, and we do with our childbirth classes online, is talking to mothers on the benefits of the golden hour, encouraging the exclusive breastfeeding. And as Dr. Rati and all of you have said, it's free. But in order to do that, we need to ensure that during the antenatal period, we consult our mothers and ensure that they're having the right diet. And it's a whole holistic event to getting them prepared. And to sustain breastfeeding over 2 years has been the WHO recommendation. And how does breastfeeding works? And we need to educate moms and families to tell them how it works and how the process of lactation, because that will also help them not just for breastfeeding, but also during the birth and the suckling of the baby and the emotional status too. And the constituents. Now, a lot of women are thinking that the colostrum doesn't provide much, and it's really important to educate in the antenatal period on the first few days, because a lot of women have been pressured almost to feed the baby a bottle, saying that there's not enough of milk. So it's important to show them a picture and to tell them about the benefits and the antibodies that's going to help. I'm not going to read it all, but we will go through it of the benefits to the baby. And it's important to talk to them about the foremilk and hide milk too, and how it'll help sustain that. Now, when we use this, because a lot of women have been asked to supplement with a bottle, but if you show them on day one the size of the newborn stomach, it's no brainer. The baby is going to have what the baby needs, and the colostrum and the milk that the mother produces should be enough. So the top-ups are not required. But there's a lot of family pressure. So as I said, not just educating the woman on, antenatally, so it's also important to include the families in those discussions as well. And why is it recommended? And some of you have alluded to it. It's digestible, the right nutrients, it's served at the right temperature. It protects a baby against infection, and later on in the onset of adult life, it prevents diseases. And for the mother, the benefits of breastfeeding, like it reduces post-birth bleeding and anemia, it helps delay the next pregnancy, and also breast, ovarian cancers, osteoporosis is reduced. There's a protection against that, and it's so convenient. Not everything from the West and feeding the bottles, it's good. But a lot of women are very focused, and if they think somebody else is doing it, it's good practice. So we need to bring everything back in perspective and empower women and tell them how the benefits of breastfeeding is going to help the baby, for the growth, protects the baby against infection, and enhances brain and visual development. And babies have a higher IQ. And the most important thing of the emotional bonding, that golden hour is so crucial. And it can be done even for some mothers who may need a cesarean section if they have a placenta previa. And breastfeeding can be initiated in theater in the golden hour, as Dr. Rati had also said. So for the environment as well, how is breastfeeding going to help the environment? There's going to be no packaging, shipping, disposal. It's friendly to the environment, it reduces the cost, and it's more ecological. We have to be thinking about these things right now. And also, we may be having COVID, but it's not an excuse of reducing our breastfeeding and also bringing into the rooms. So the benefits of breastfeeding, breast milk and formula milk, as you can see, it's broken down into the microbiomes and how important microbiomes are and how it helps with the development, the antibodies. It's baby specific. So it's so important to tell mothers and to inform them about the benefits so they can make that informed choices as well. And the techniques, I'm not going to go through this because I'm sure my colleagues will, but if you show them in preparation of pictures and correct attachments, that's going to help them. Because if a mother, sometimes some mothers may have perineal tears and that may put her off, but if you could share the positions that she can actually go into, that might help her, that she can feed the baby in different positions. And I think that's important to show mothers the pictures of how they can support breastfeeding if they've had a painful perineum, or if they had a cesarean section, the different positions that she can side lying, and that will, enable her to breastfeed. It's not just about sitting in the chair all the time upright. She may need rest in between as well. So counseling skills, how we counsel and learn with mothers, and how we help them to build up their confidence. It's so important as well. We need to ensure that they do understand. And a lot of mothers, sometimes it may be a language barrier, but a lot of us may use nonverbal communications, and we should give her the time and the privacy in the antenatal period to share. Pay attention, remove barriers. And if somebody in the family advocates for a bottle, and this is where the exploration and community learning can happen. So breastfeeding needs to be done as early as possible, and the information also needs to be shared from professional midwives collaboratively, and also the ASHA workers out there are key to talk about breastfeeding and how important it is. And that would build up confidence and giving them support. And we need to also accept what a mother thinks and feels. And in order to do that, we need to give her an opportunity to communicate. And after the birth of the baby, we need to praise her that what she's doing is right, and giving her the practical help. And the most important thing that we tend not to do is listen to mothers. Use simple language and suggest, and not in an authoritative way. So we need to empower women, and that is key, and that is also so fundamental. And there is a lot of myths and misconceptions, as I found out in my journey, 4 years journey now in India. And some of these, small breasts will not produce enough of milk. And it's important to talk to women about that. And a lot of cultural, some women stopped eating certain foods because they feel that the babies are going to get bigger. But that's not true. And these misconceptions should be also helped as early as possible. Like for instance, a mother recently said to me, but my mom said that my baby should be offered both breasts for every feed. And that's when the baby was just getting the fore milk and not the hind milk. And sometimes, they want to supplement the baby during the hot weather, and it's easier to bottle than breastfeed. So these are some conceptions and what they can eat and not eat. And some of them say formula milk is the same as breast milk. So this is where the nutrients and the demarcations, and we need to tell them what the differences are and how it's going to help the baby in the future life. And some say you can't breastfeed if you go back to work, but a lot of employers out there are baby friendly. Hospitals are baby friendly. So there is dedicated rooms now to employees so they can have the privacy to express and to breast milk. And another one is you should not breastfeed when you're sick. And that's not true. We know that the status as well, even with HIV mothers and mothers with cesarean sections, the status of feeding has changed. And all of this needs to be explored with, and washing of the nipples every time. So these are some myths and misconceptions. And the antenatal period is the period where all of this should be explored, because women need that. Women need the safe space to talk about and in preparation, because it's not just about birth. It's also about preparing her for the period afterwards. Postnatal care is not a Cinderella service. It's equally as important as early as possible. So thank you very much for this opportunity.
Thanks, Cindy. Dr. Bhaskar sir, you're a co-host now.
Dr. Sister Vinoda, you are ready? Sister Vinoda? Vinoda, you start your lecture.
We will start with the next lecture, Dr. Vinoda. Madam, you are given 15 minutes time, madam.
Vinoda, unmute yourself.
Hello everyone, I'm Dr. Vinoda, physiotherapist, lactation consultant, and a childbirth educator. Thank you very much for giving me this opportunity, and I feel really obliged to be part of such a great event. And I would like to start with the presentation. So when we talk about the role of breastfeeding, it is an immeasurable part of our life. And
Vinodha, sorry to interrupt. Could you go full screen?
Sure.
Share the screen.
Yeah, share the screen from the first slide.
Yes.
Go ahead.
So, yeah, you, me, and we all exist here right now is because of that, what we received, the first drop from our mother's breast. It is the first step for the development of humans and is the foundation of life. Breastfeeding is an intimate and emotional experience, but it is also a primal event, and it is dating back to millions of years to the first animals that walked on land. Humans are classified under mammalia, meaning breast, and all mammals can lactate. This should not become the past. Let's come back to our modern life, to the modern women. A woman who is juggling with lots of roles. The roles of a modern woman are entirely different from the roles of women in the past. They are managing their work, their marriage, their kids, everything they do. And what does breastfeeding mean to her? With the increased roles that she is having, is she being supported enough? Just that breastfeeding is natural and healthy, does it mean that it is easy for this modern mother? Is she having the enough support to do the breastfeeding exclusively? Why are the mothers not able to breastfeed? Why does our national survey show still the breastfeeding rates need to improve? I must say that it is not her fault. We as healthcare providers or as a government or as a family or as a society have failed her. Did we meet her needs? Did we support her enough? Are the questions to ponder. This is the time when evidence and empathy are not enough. This is the time when awareness and preaching isn't enough. This is the time when the mothers need practical help. Preparing mothers for breastfeeding in postnatal wards. Dr. Indy Kaur has mentioned the antenatal preparation of the mothers, and I would like to discuss postnatal wards. As a nurse, do you think are our babies and mothers off to a healthy start? Early initiation of breastfeeding has lifetime importance for mother and baby. Feeding within 1 hour after birth is an important infant and young child feeding practice. National survey shows poor breastfeeding initiation within this 1 hour. Evidence shows that mothers who breastfeed within this 1 hour do well with breastfeeding at 3 months and 6 months of infant's life. Why is this first hour early initiation so important? Newborns who do not initiate breastfeeding early on have greater risk of having common infections and have 50% increased risk of breathing difficulties in the first 6 months of life. Increased risk of death when compared to who breastfeed. The more the delay, the more the risk. It is this time that newborns can be fed on colostrum, the first food that from the milk drops that provide the passive and active protection and a wide variety against a wide variety of pathogens and reduces the neonatal mortality rate to a great extent. So what is the solution for this? To have skilled and knowledgeable birth team, including the nurses, trained nurses, doctors, and allied health professionals to make this happen. Modification of hospital procedures, reducing the C-section rates, decreasing use of formula, implementing baby-friendly hospital initiatives, antenatal counselings for mother and family. So I would like to discuss, after the first hour of breastfeeding, different case scenarios that we usually see in the wards, in the postnatal wards. So I would like to do along with case scenarios, not just simply talk. So this is case scenario 1. Mrs. Roy is a 32-year-old first-time mom, and she delivered twins through C-section. And babies weighed 2.8 and 3.2 kilos and were healthy. She shifted to postnatal ward and complains that she's unable to breastfeed her babies. So what is the problem? She has 3 problems here. She tells that her nipples are inverted. You can see on both the sides, and is also worried how to feed twins. Will it be enough? So what and how do you address these issues? The management is check if the nipple is inverted or retracted simply by doing the nipple protraction test, and encourage football hold for feeding twins just in case the mom is finding that or worried that what if the other baby cries. Explain the right technique to feed with such nipples. Discourage the use of syringe, discourage the use of pump, nipple shields, formula, and explain the mother the different size and shapes of breasts don't matter and babies can breastfeed from almost all of them. See how wonderfully here these two twin babies breastfeeding from, at the same time, breastfeeding from two inverted nipples from this mom. So explain breastfeeding multiples can be done. All mothers can breastfeed one or more infants provided they have correct information and support. Nursing professionals should have this knowledge and skills to provide the advice and assist in breastfeeding. In case scenario 2, this is Radha. She's a first-time mom. She delivered baby through normal delivery without epidural anesthesia. She had a healthy baby girl and birth weight was 3 kgs. Baby has been breastfed for the first time within 5 minutes after birth. Radha's happiness knew no bounds. She has been exclusively breastfeeding from past 2 days. What is the problem now? It is day 3 and Radha has a severe headache. And as she's been crying all the day, she complains, I've been bearing the pain when my baby latches and I can't take this pain anymore. Pain is more than the labor pains. She asks for formula and bottle feed. So how do you address this issue? On observation, you notice that the visible fissures across the tip of the nipple and around the base of the nipple, and you identify it as sore nipples. What is the cause? The cause is a poor attachment. Explain her breastfeeding is not supposed to be painful. She is only supposed to feel a tugging sensation. Explain her how to improve the position and latch. Apply hind milk and expose to air. Discourage the use of formula, bottle, pump, and nipple shields. So why does a shallow latch be painful and cause nipple pain? It is because the baby's gums are chomping on the nipple. The baby's tongue is rubbing against the tip of the nipple, just like a sandpaper brushing. But in a deep latch, the baby's gums are around the areola and the baby's tongue is wrapped along the areola, not around the nipple and not rubbing against the nipple. So in a case scenario 3, this is Sheetal. She is a second-time mother and she delivered through C-section. She had a healthy baby, birth weight 3.5 kgs. She did not breastfeed for firstborn. Reason was inadequate supply, as she mentions. The problem comes on day 4. She complains of severe pain and hardness in both the breasts. You see that the breasts are swollen, are edematous, and the skin looks shiny, red, warm, and she has fever. Nipples become stretched, tight, and flat. So what is the cause? This is because of infrequent removal of milk, delayed starting of breastfeeding, and poor attachment. So how can we prevent this? Start breastfeeding soon after delivery and ensure good attachment, good unrestricted feeding. So how do you manage this breast engorgement, removing the milk from the breast? Baby is able to latch and suckle, breastfeed frequently. If baby is not able to suckle, express the milk by hand and try to feed by spoon till the breasts are softer. Once the breasts are softer, you can again put the baby back to the breast. After the feeds, you can apply cold compress on the breast to reduce the edema. So there are certain etiquettes. Every nursing personnel or professional, anyone who is attending and helping these mothers to breastfeed, you must have a certain etiquette. Please explain what you want to do. Please ensure there is privacy and ask permission. If you're touching her breast, be gentle. And basically the management is, you should have good counseling skills. You should have good knowledge before you counsel the mother. Listen and understand the difficulty. and take down her feeding history. Her feeding history is the solution most of the time. Observe a breastfeed. Without observing, do not be in a hurry. Ensure there is proper attachment. Completely empty the breast. Mother's psychological and physical well-being are very important. So please show empathy and be kind to her. Build mother's confidence and never be critical about her breasts. So can COVID-19 mothers breastfeed? Yes, of course they can. COVID-19, firstly, know that it does not transmit through breast milk, and breastfeeding within 1 hour after birth boosts the child's immunity with direct transfer of antibodies and essential nutrient. So it is very important to breastfeed. Just in case if a mommy is suspected, she needs to take the basic precautions. If she's confirmed or suspected, the mother should practice the following to prevent transmission of infection to that infant, especially while breastfeeding. She needs to wash her hands before touching the baby. She has to wear a mask. Probably the family members too need to wear a mask. Disinfectant, or she needs to clean the surfaces frequently, but it is very important that she should not use a mask for her baby. And in case the mother is unable to breastfeed due to sickness or any medical emergency, following options should be explored, which is expressing out the breast milk or using human donor milk or wet nursing. It is safer to use cup and spoon to feed expressed milk, and WHO recommends breastfeeding for all mothers irrespective of their COVID-19 status, except the mommy is on a ventilator. Most of the mothers are recommended. Healthcare workers should build the confidence of the mother and help her by breastfeeding counseling during antenatal checkups, during the time of birth, and even the postnatal visits. So this year's theme, Protect Breastfeeding, a shared responsibility, is a responsibility of every one of us. Thank you so much for giving me this opportunity. And I'm ending the screen share.
Thank you, madam. Thank you, Dr. Vinod garu, for enlightening all the practical problems faced by antenatal mothers. And we also take over the consideration of the role of mothers and mother-in-laws in deciding whether to continue breastfeeding and whether to continue, initiate, or how long to continue, because they influence more on the mother. And we have to give right direction regarding the guidance regarding the fore milk and hind milk, and what is the importance of completely emptying the breast. And these are the minor advices we have to give, but they carry a lot of weight in. Of course, they are initiating the breast feeding, but they are not continuing up to 24 months. Hardly maximum 10 to 14 months they are continuing in 60% of feeding mothers only. So very few mothers are continuing up to 24 months are what we are advising. So with this, thank you, madam, for highlighting all the practical problems. Now we go to the third speaker, Dr. Alimelu, madam.
Yes, sir. Good afternoon, sir.
Welcome, madam.
Yeah, good afternoon, sir.
Good afternoon.
Sir, should I start sharing?
Yes, madam.
Oh, good afternoon, everybody. Greetings from Nilofer Hospital. And it's a great honor to be here on this platform. And I thank the organizer for giving me this excellent opportunity. And I'll be talking a little about the quality initiative we did in our hospital and how it actually improved the initial first-hour breastfeeding rates in our hospital. It has been a dramatic increase, and that's why we are very proud of it, because the whole team, I have to give the credit, major credit to our obstetric team and our nursing faculty. So I'll start off with the first slide telling us, as already mentioned, that it's the most important intervention. So it's the most effective way to ensure child's health and survival, and every child should be breastfed within the 1 hour. And of course, exclusive breastfeeding for the first 6 months. And we have known that this saves about 8 lakh children, and this is the WHO analysis. So these are the 10 steps to successful breastfeeding. These are the 2018 latest changes. So if you see the first one, there has been major changes here that it's broken down into A, B, C, and compiling fully with the International Code of breast milk substitutes, and having a written policy communicated to the staff and parents, establish ongoing monitoring and ensuring sufficient knowledge and competent skill, discuss the importance and management of breastfeeding with pregnant women, and facilitate skin to skin and support mother in continuing breastfeeding, support and initiate breastfeeding with and solving all their common difficulties. Do not give any other pre-lactal feed or any other feed except breast milk, or even medically indicated. Only if few vitamin D drops probably is okay. And ensure that mother and infant stay together. Rooming is as advised. And look at the most important thing: support mothers to recognize and respond to their infant cues for feeding. So this is one of those important things that has been there. And counsel mother, and of course the community. So this is the government initiative, the MA program, Mother's Absolute Affection, where the hospitals and everybody has to know about, the community has to know about it, and that's, we take the mass media's help for that. And ASHAs, the capacity building, ASHAs and ANMs are main crux for the program, and recognizing the delivery points and training them, and of course constant monitoring with aborts is one of the main things to look at. And if you see, even though this is such a common thing, that this is something which we always talk very fancily about breastfeeding counseling, but definitely this was one of the intervention that which dramatically improved our rates of breastfeeding. So even though this is common thing that we always listen to, but we never do it properly. So counseling is the main thing, especially the antenatal mothers, talking to them about how important it is to breastfeed, and the first initial 1 hour after birth and maybe 6 times in a day. And due to COVID, we did have a lot of problems with face-to-face counseling, but we can definitely go on to do with the telephonic counseling as well. Why breastfeeding? Why is it important to start early? When I mean early, as soon as the baby is born. I don't even want to delay up to the first 1 hour. I'll tell you why in the next slide. Because early initiation of breastfeeding is known to cut down the neonatal mortality by 22%. That's a huge difference actually. And if you see, exclusive breastfeeding for the first 6 months will reduce the under 5 mortality by 13%. And this is some words which I saw in the one of the literature on internet, and it somehow is so very impactful. It's a more specific, personalized, sorry for the spelling mistake, personalized medicine for the neonate. So how else to describe that? It is such a personalized medicine for the neonate for life, which causes gene expression that is fine-tuned for a very healthy life for the neonate. And it is an health printing for the life. That is, we can prevent all the long-term diseases like obesity, diabetes, allergies. So this is the elixir of life. Why we shouldn't delay? Because for every newborn, every new minute that is delayed counts. So the risk of infection and death increases 4 times with the longer the delay. That is, if it is going beyond 1 hour. So if you see the delay, if you are waiting for 2 to 23 hours, the risk of death increases by 1.3%, and it increases to more than 2 times if it is beyond 24 hours. So that is the importance of starting early initiation. And this is the golden hour which we all know of, and this is that breast crawl so dramatically that has been recorded, and this is such a nice experience. This is once in a lifetime, and it should be never lost, because I think in our lifetime, this first 1 hour, we are the most active, and this is where we need to bank on. So this is the time that you have to catch hold of. And if you look at it, it is those 9 phases of the behavior, instinctive behavior of the neonate that we bank on when the baby is doing the breast crawl. If you see it starts to cry after birth, then the baby relaxes a little, then the baby is awakening. There is some activity of the baby. This is where you start to feed the baby. This is the 4th stage where baby will have mouthing and a little suckling, and the baby is a little more active at that time. Then the baby takes rest and then starts to crawl, recognizes the breast and by the smell, and it goes to the nipple and starts sucking because of the familiarization. And if you see the last one, 9th one, that is where the baby is tired and sleeps. So this is at the end of 1 hour. And that's what most of us do. At the end of 1 hour, when the baby is taking rest, that's when we insist that the baby should start feeding. We are not at all helping the baby. And this is one more article from Cochrane. They've analyzed 46 trials, and these 46 trials have included more than 3,400 mothers, and they've seen how skin-to-skin contact immediately after birth helps the baby. So they've seen there is better infant feeding scores, and longer duration of breastfeeding has been found with skin-to-skin contact, and better stable cardiorespiratory scores. And most importantly, these babies had higher blood sugar levels when they do skin-to-skin contact. So that's why as soon as the baby is born, that's the important thing. And we also wanted to see how our breastfeeding rates were at Nilofer. And we started off with an aim statement because we sent a nurse or one of the persons of our QI team without anybody knowing that she's going to analyze. We analyzed how many babies were started breastfeeding in the first 1 hour or even before, as soon as the baby is born. And we found at a very dismissal rate of 18%. But we are telling you, this is a very busy teaching hospital. But still, we tried that we'll aim this to 70% at the end of 6 months. And we formed a QI team of nursing staff being the leader, the obstetricians, the pediatricians, and the PGs, including the nurses, including the patient support staff. We have a 4th class employee team where they are labeled as patient support staff. So the team was included, and we found some of the problems by analyzing. So this is the fishbone analysis that we did at our hospital. Each hospital will have their own unit problems. So we look at place, what were the problems, what were the problems with the person, procedures, policies. And this is how we analyzed to see which were the major problems. And we thought that most of the time there will be one problem which will be the cause for 80% of the other problems. So that is called the Pareto principle. So we realized that that was basically because of the lack of awareness, and increasing the awareness was the major important change that we thought that would bring in. And that is how our change of ideas were. So sensitization of nurses, doctors, and support staff, documenting antenatal counseling. So we were thinking that we are counseling, but we started to document on a paper. Birth companion to be identified and counseled for exclusive breastfeeding, early initiation of breastfeeding, use of a stamp to indicate that the early initiation has been started. And this again was documented and signed by the birth companion. And the birth companion was always the relative of the mother. And using a separate column in the newborn case sheet dedicated to breastfeed alone, creating messages through WhatsApp group, using IEC material in our KMCs, in our antenatal ward, postnatal ward, in our labor rooms, OAT, and even OPs. So we did try maximum by actually advertising and having a written policy, and we were regularly monitoring all these methods. And our data collection was being done weekly to see which was the most effective intervention that improved the breastfeeding rates. So if you see, this was the most important breastfeeding intervention, like I told you, antenatal counseling. So from 16%, it increased to 30%. So most of it was 15%. And we documented that these mothers were counseled. So we had a small card saying that the mother has been counseled. And then we had a second counseling where the birth companion was recognized. The birth companion could have been the mother of the patient or some auntie who was with the mother. And she was told that we want to start the early initiation of breastfeeding. And what we did was initially to encourage everybody, along with the sisters and the fourth class employees, I myself and along with our PGs, we used to go stand there, see as soon as the baby starts to cry, even before cutting the cord, we tried to put the baby onto the mother's abdomen. And we saw that the baby is stable. And after cutting the baby, we took the baby onto the mother's breast along with the attendant. We made the care companion do that. So the attender of the mother used to put the baby onto the mother's breast to start feeding. So this intervention also worked out very well. And we tried to counsel her every day. So each day counseling and whether the STC was also implemented. And of course, we saw to it that there was a stamp, and this again was very effective. And because in the long term, this documentation also worked out later, because even we went back and looked at the case sheets and we saw that the case sheets had the stamp signed by the signature. So we saw that it was signed by the mother's attender or the care companion who was with the mother. So we had the stamp saying that the breastfeeding was initiated. And this was again very, very important thing again here. This was again 8% IEC material, because sometimes we think that they do see IEC, but they don't. So this is one intervention which we can, but it does make an impact. Some mothers actually look at it. And we also saw that this also improved for more than 11%. This is the most important thing I would like to mention, because our obstetrician, our professor, HOD of obstetrics, really believes that this can help a lot, and still this is being continued in her case sheets. So even if the card is not available, they do document that the baby has been breastfed and early initiation has been done. So this is all these. So this has been included into our newborn case sheets, and this is the run chart. So we started to look at it every time after an intervention was used, and we saw how it rose. So the most heartening thing was, from a dismissal 17%, we came beyond 82%. Of course, there has been a fall during COVID, but we are going to go back to our, because again, we have a change in the nursing staff and in our fourth class employees. So we need to go back to them again. So right now it's between 67 to 70%. We try to plan to go back to 80% by implementing the stamp. And even the 60-70% is because of our obstetric department. And of course, we did not see an improvement equally in cesarean births. I think this is because of the complicated cases which we get at Nilofer Hospital. But next initiative would be to do even QI for the cesarean sections and early initiation. So this is one of the things which I wanted to mention here. These stamps are actually now from the NHM. So the green stamp is for the stamp that we use in the labor room, starting as soon as possible. So this will have a date and time of initiation, time of delivery and initiation of breastfeeding, and the signature of the staff who has conducted the delivery. So it's the responsibility of that staff. And then a blue one, of course, this blue one is that in case there was some issues and then the baby was breastfed in the postnatal ward. So this also tells us when the baby was breastfed in the postnatal ward. So this is only for the indication. But the red one is if in case the breastfeeding was not started at all, to mention why. The reasons have to be mentioned in this stamp. So this is something that the NHM has come up, and it will be scaled to all the birth centers in few days. So to come to the summary of my talk, the most important crux is counseling, antenatal and of course postnatal, so that they continue breastfeeding for the next 6 months or maybe 2 years. Increasing awareness. We do have a CCP program, we do have KMC ward, we have lactation counselors from Datri Milk Bank who come and keep talking to the mothers. And what is heartening to know is I've seen some of the aunties who are along with the mother counsel the other mothers also, and they give some support. So this is also a very good program that is increasing awareness. And I heard in a talk about bonding angels. These are people, some helpers or ANMs or ASHA workers who are employed to stand when the baby is delivered. And as soon as they hear that the baby has cried, that they ensure that the baby is put on to skin contact. So they have been labeled as bonding angels. So skin to skin contact is the most important intervention, because this is where the baby is, like I've already mentioned, that baby is more active and the baby's sugars are more stable. They start sustain breastfeeding. They take breastfeeding for a longer time, and mothers are more confident when we do skin to skin contact. And but you always have to look what works at your place. Every unit is a different unit, so see what works best in your place. Sometimes we can do cost effective things. It's not that we always need to employ. With the available staff, we can still improve on our system. And but of course we have to keep doing regular monitoring, because without monitoring, how would you know your improvement? So monitoring is very important. Audits are very important, and it has to get implemented into our system. That is the most important thing that we have achieved. Even though we could not achieve 80% due to COVID, but still we are around 70%, and we plan to hike up in the next few months. So these are some of the heartening pictures. So we keep doing counseling in our KMC wards. We keep asking the mother to counsel. We see how much they have understood after we explain to them. We tell them why prelactal feeds are harmful. So this mother was, I think, a little educated, and she was telling me that why honey has to be not given as a prelactal feed. And we have many success stories where we had twin deliveries, twin babies, very preterm, 600 grammars, 700 grammars, but still without top feeds, only on EBM, being discharged after weight gain. And the last picture which you see is the picture where the mother had triplets, and most of the two of them were less than 1 kg, the other one was 1.2, but all three discharged after gaining weight on mother's milk only, only mother's milk. So this is the great success, and to tell you that we can still have very good survival and weight gain with only mother's feed. So our acknowledgement to our obstetric department and to our nurses and all the fourth class employees who have helped us through this initiative. Thank you. Thank you.
Thank you, madam. Our professor used to say that initiation of breastfeeding less than 30 minutes after delivery is the last stage of labor. And I appreciate you for doing a great service in increasing the percentage of babies being given breastfeeding. And with my little experience, I have 1 or 2 remarks, madam. When the mother has not given breastfeeds to the first child, it is very difficult to counsel them in the second delivery. And in every counseling, we have to take into the conference the husband and other elders in the family. And we should have, stress the importance of adopting these breastfeeding policies for every birthing place or maternity clinical establishments. And we have to request them or enforce them to adopt these 10 steps of successful breastfeeding. And we should have a national or district level coordinators, including all stakeholders, to monitor and encourage the professionals, first itself professionals who are at fault. In my experience, doctors not giving much time to counsel the mothers, to be frank, with due respect. And this lactation counselors or breastfeeding counselors, they should not be confined to corporate hospitals. Government or NGOs should see that they are placed in every clinical establishment as a dedicated lactation counsel should be there. It is the need of the hour, madam. Thank you. With these few remarks, and I hand over to moderator Professor Vijay Kumar. Thank you, Vijay Kumar.
Right, sir. Dr. Srikrishna, shall we take the questions after?
Sir, finish the questions which came now, yeah. Sir. I posted them to you. You can answer them.
Yes. How can one solve the problem of inverted nipple without using syringe? We know that, madam. Somebody doesn't want to use the syringe and still want to have the solution.
Yes, sir. In my experience, I generally discourage the use of syringes, and we have been successful in doing so. We first check the retractability of the nipple. If the nipple is able to come out, it is actually very easy unless it is very much the tissue is adhered in it. Just by pulling it out with a hand and making the baby suckle on it, it will definitely come out. Maybe if not in the first attempt, definitely in the second and third attempt. So, like I have shown the picture also with the twin mother of twin babies, she was having retracted nipple, but once you are able to make the baby latch over it, definitely it is going to help out. Rather, the syringe what we use, at least the syringe should be bigger in size. In most of the hospitals I visit, I see that the syringe is 10 ml syringe, very thin one. And actually the mother's nipple also is not fitting into it. That is the first time I realized that I should discourage this kind of syringes. At least counsel the mothers to use a bigger syringe, or counsel the nurses to give a bigger syringe, a 20 ml, a 30 ml, depending on the size of the mother's nipple. Sometimes it is just not the nipple. The areola also is tough around the nipple. The areola is also tough. So in this case also the massage and using a bigger syringe might help. But without that, it is still possible to bring out the nipple just by making the baby suckle often.
If antenatal, in the antenatal examinations, if things are really good, how much we can reduce? Alipelu madam or Vinoda madam, in case antenatal examination of breast really we improve, how much we can decrease seeing this in postnatal wards?
Sir, usually nipple is not, in antenatal period, it is not done. They don't do the retraction, I mean, because it may induce labor. So we can tell the mother to take simple basic care of the breast, but the intervention, whatever we are doing, should be after delivery.
Yes. Thank you, madam. There is one more question. For disorders like cleft palate, what are the measures to be taken during breastfeeding? Whether breastfeeding is possible at all? The question I am reading as such. Is breastfeeding possible at all, madam?
Yes, sir. It is possible even with cleft lip and cleft palate. The baby can be kept upright. The cradle, the upright position, and then they still can feed. And what they can do is usually the tongue can actually, if the baby is held upright, the tongue forms the seal over the gap, and then the baby can still feed onto the mother. So it still can be breastfed with that. Or it's also Haberman's nipple is also available, but I think the easiest would be the positioning of the baby, sir, to feed, because that way it won't even go into the ear, and because of gravity it goes down to the stomach.
Vijay Kumar sir, before you proceed, there's one question which had come up and I'd like to answer it with your permission. So this is Rini who says that it's easy to make people from low socioeconomic and middle class group to initiate and continue breastfeeding. When it comes to high socioeconomic mothers, they want to rest. They don't want to breastfeed. I stay at Gachibowli. I am probably at the high-tech city area. I'm at Financial District, and I see most of these mothers. Let me tell you what convinces a mother at Nilofer and a mother at Financial District Gachibowli is the same. It's just knowledge. What matters is the amount of time you spend with them. No mother, trust me, no mother will say, I am first. It's always the baby first for the mother. Because she doesn't know the harm she does, she might end up doing it. No mother ever will willingly put herself all the time first. So all it takes as healthcare providers is for us to tell the mother the correct knowledge. Tell them that doing this helps the baby. Trust me, no mother will hold back. She will go all the way. She will go out of her way to ensure that it happens. The problem is that we don't have that much time to convince, convey, and persuade the mother. If we can make this happen, and trust me, it's only a one-time thing. If you can have effective communication happen, even in 10 minutes in the first visit, it stays for a lifetime, not just with her, but with the generations. She'll tell her sister, she'll tell her neighbor, she'll tell everybody. I am convinced you also do it. So I don't really think it's a problem of the socioeconomic status, but it's more to do with our time. And this time is not available for most of us because this is not a medicine. Nothing goes on the prescription. It just needs our efforts. We'll discuss more on this. I'll request Vijay Kumar sir to proceed with the next sessions.
Yes. Madam Alimelu, madam, the postnatal ward of Nilofer Hospital is a large and diverse community in itself. So I thought that work is in the community only, or multiple communities, and a wonderful work, madam. Then, and it's also very good that it is not the house surgeon who takes care of the postnatal ward rounds. A lot of activity for babies happens in postnatal wards of Nilofer Hospital. This is something which is to be disseminated, madam. And
Yes, sir.
Yes. And
Yes.
one word is whoever has asked this high socioeconomic, low socioeconomic, the thing is very illiterate and very low education status, rural, and very educated elite mothers, education stage is concerned, they are very good with breastfeeding practices. Those people, the target people who require are the urban, the working women, all that India Cover madam was saying. These are the people whom we have to target. Thank you very much for the session. And we'll go for the next session. The chairperson for the session is Dr. A. Chakradhari, sir. But sir is actually, he will join us anytime. I requested sir for this because sir is a very senior practitioner in Nirmal. He knows different tribal women feeding practices and delivery practices. Actually, I thought he would share his experience of that because a distinct tribe community, they have their birthing processes as such intact, which are really, it is very surprising to many of us actually. And it is the other side of the world where we are thinking of a safe motherhood, all 100% hospital deliveries. But in case doesn't come, maybe I will share sometime one or two practices which are this. So I will take Dr. Chairperson, Dr. Chakradhari sir. He will join us anytime. And we have 3 topics in this session. Labor rooms and SNCUs and improving breastfeeding by Dr. Aparna madam. Aparna madam is a neonatology lead. She is trained in the best institutes of the country, All India Institute and PGI. She has multiple papers, and she is a very, very tertiary care neonatologist. And of all her CV that I have read, which is really inspiring to all my PGs whom I have shown, the best thing I share is that she is mentor of SNCU Warangal. When she comes to Warangal, when she sits with the nurses, it's actually a pleasure to watch. And other person who talk about breast milk banking, again, breast milk bank, it is coming to a periphery. There are many government efforts where breast milk bank is not a metro city thing. It will come to districts, and people know the importance of breast milk now. The breast milk bank, sister Ankita will speak. She is a neonatal nurse, and she is also a faculty in the All India Institute of Medical Sciences, New Delhi, nursing module. Again, Dr. Yadaya sir, all of you know, he talks about kangaroo mother care and how it influences breastfeeding. But then again, sir is a place where internet is now available. And now I'll request Aparna madam to give her talk. Aparna.
Thank you very much, sir, for the very kind introduction. It's indeed my pleasure to be associated with Warangal. I enjoy it as much, as you said, every time visiting there. And today, I thank everyone for giving me this wonderful opportunity for being a part of this International Nurses webinar and to be speaking about improving breastfeeding in the vital areas of all our facilities. We all know that a good feeding for breastfeeding should begin early, ideally from the prenatal phase. And in this session, we'll be discussing about the interventions in our delivery rooms and in our SNCUs and NICUs to establish or to improve the rates of successful breastfeeding. So we know that for the success of breastfeeding, we basically need a continuum of awareness starting from the preconceptional age, as has been already pointed out by the previous speakers. So breastfeeding importance and awareness should start right from school age curriculum and should be continued as a part of adolescent counseling and with normative presentations of breastfeeding and with health education pamphlets and with awareness about the importance of good nutrition right from adolescence. And in the prenatal phase, it has been shown time and again in repeated studies and meta-analysis of randomized controlled trials have shown that prenatal education and prenatal peer support goes a long way, not only in improving the self-ascertained or self-assessed efficacy of breastfeeding, but also in the success of exclusive breastfeeding rates clinically. Structured clinical education programs and workshops about the benefits of breastfeeding and about the detection about breastfeeding issues have actually been shown in clinical studies to improve the success of breastfeeding and the success of early initiation of breastfeeding. Now, when it comes to the intrapartum interventions or interventions in the labor rooms, we have again seen that the baby-friendly hospital initiative, as Alamelu ma'am pointed out to you in the previous talk, the 10 successful steps of breastfeeding have all been shown again to improve the success of breastfeeding. And we shall be discussing again about some of these aspects. A lot of them may have been previously discussed, in fact. Now, in terms of postpartum interventions, of course, pediatricians, nurses, and lactation counselors, we all have a great role to play in improving the confidence and the trust of mothers and in providing them the necessary professional education training and effective counseling for the continuation of breastfeeding and in the redressal of common breastfeeding related issues. Now, when it comes specifically to the postpartum breastfeeding of babies who are in the neonatal intensive care units, here comes the role of early expression of breast milk with breast milk pumps or with manual expression, and in targeting or in aiming for an effective sustenance of human milk feeding among the preterm NICU graduates. There is a very important role on education of the families and fathers especially, and other support members, and the importance of this cannot be underestimated. Now, coming to the labor rooms, firstly, as the previous sessions have already been emphasizing again and again the importance of early skin-to-skin contact. We all know that skin-to-skin contact begins ideally from the time of birth and should last continually until the end of the first feed. And this is found to have a lot of neurobehavioral effects and evokes the intimate contact, which is inherently important to influence neurohumoral changes, which are very, very important in order to initiate as well as continue and sustain breastfeeding. And some of the clinical benefits seen with early initiation of skin-to-skin contact, particularly in near-term and term infants more than 35 weeks of gestational age, include increase in exclusive breastfeeding rates at 4 months, higher by 24%, duration of breastfeeding longer by nearly 64 days or 2 months, and breastfeeding effectiveness assessed by some scores like IPFAT are found to be better, and all these cumulate in a 32% increased likelihood of the first successful breastfeed. It is also associated with higher blood glucose levels and higher SCRIP scores, which are associated with stress levels assessment, which are found to correlate with lesser stress levels and similar temperature. So not much benefit when it comes to hypothermia prevention, but better glucose control and better success of breastfeeding rates with the initiation of early skin-to-skin contact in all neonates who do not require the care in a radiant warmer. So all of these babies can be placed immediately on the mother's chest, between the breasts on the mother's chest and abdomen, and can be allowed to remain in this position until the first feeding is initiated. And this single intervention has the potential to push up exclusive breastfeeding rates by at least 20 to 30%. And we all know that, and we have already discussed that early initiation rates have actually come down in the recent NFHS 5 survey. The next important step is, of course, remembering all the 10 steps to successful breastfeeding. And I shall not reiterate this because this has already been discussed in detail, but I would just like to reemphasize that having a written breastfeeding policy that is uniformly communicated to all the staff in the hospital, the nurses, the doctors, the lactation counselors, and to this other support staff, and displayed in the labor rooms and in the postnatal wards goes a very long way in reinforcing our support in promotion of exclusive breastfeeding. And of course, we all know the other steps, including early initiation of breastfeeding itself. A very important role comes here about the elimination of industry marketing, and it has been found that wherever there is a weak code or no code, which means there is failure to reinforce the kind of deferment of industry marketing and promotion of products, or diversification of infant milk substitutes in the form of infant formulas or follow-on formulas or toddler milk formulas, and failure to have a strong code can actually negatively influence the success of breastfeeding. Now, when it comes to early initiation of breastfeeding, again, it has been spoken about. We all know that all the professional bodies emphasize that the first breastfeed must be started within an hour of birth. And when it comes to quality improvement studies, which have looked at this, especially after cesarean sections, where it is still considered to be a challenge, I am quoting this study published in Indian Pediatrics in the year 2018. There are a number of factors when we look back at the fishbone analysis, including policy, people, procedure, and place-related factors, which may hamper the early initiation of breastfeeding. So, for instance, not having a clear policy on early initiation, suboptimal awareness of the staff involved on the importance of early initiation, and when it comes to procedural problems, forgetting about feed initiation after the cesarean section, or doubts in role allocation, and when it comes to place, lack of a systematic place or lack of privacy for in recovery rooms or in transitional areas for mothers to start early initiation may be some of the factors which can hamper. When it comes to potential solutions, again quoting from the same study, where it was found that when mothers could be put onto the breast in the transition rooms, which are just outside the OT, because in most centers you might find that the time required for the completion, the suturing and completion or moving the mother out from the cesarean section theater itself might take close to 45 to 50 minutes, and this itself renders early initiation impossible. So it was found that when you start putting the baby onto the mother's breast right in the transition room by a female attendant on the trolley assisted by the labor room nurse, the mother could actually initiate breastfeeding on time. And having this as a reinforcer or a reminder in the form of information pamphlets displayed in the operation theater and regular WhatsApp messages posted within the nurses groups actually helped in reinforcing this practice. There were separate reminders placed on the anesthetist trolley, the radiant warmer, as well as on the nursing station, reminding all the healthcare staff to repeatedly remember to initiate early initiation of breastfeeding, even in mothers who have delivered by cesarean section. And the combination of all these test changes, which were implemented in the form of PDSA cycles, was actually found to improve the rates of initiation of breastfeeding to almost nearly 100% within a span of few weeks. Now, when it comes to the interventions which are associated with better breastfeeding rates in the postnatal wards of SNCUs and NICUs, it is always useful to have a systematic assessment of the breastfeeding or systematic assessment of latch using different readily available scoring systems. And it must be made a practice when pediatricians go for their postnatal rounds in SNCUs, and in the hospitals, busy district hospitals, or maybe busy private hospitals, corporate hospitals. We must always remember to spend at least 15 to 20 minutes in talking to the mothers and trying to find out whether breastfeeding has been effectively established. And this can be assessed by taking some aspects of history, such as whether the baby has been taking 8 to 12 feeds in the first 24 hours. Is the baby generally calm and relaxed during feeding? Does the baby have deep rhythmic sucks? And is there any audible swallowing? Does the baby generally feed for between 5 to 40 minutes duration? And does the baby come off the breast spontaneously? And what is the weight loss pattern? Is it within the acceptable norm of 10%? And what is the assessment of the skin color? And when it comes to assessment of the urine output, so the baby is expected to have at least 5 to 6 wet nappies in the first 24 hours and 2 dirty nappies in the first 24 hours. And the assessment of mother's breast and mother's latch. So there are various scores for carrying this out, and every hospital should be able to design one of their own, which can be easily implemented, and this must be run in the form of a checklist during every postnatal ward rounds. And this is definitely a time-taking exercise, but worth the effort. One has to remember that the enhancing factors for prolactin, which is fundamental for the production of milk includes 1, early initiation of breastfeeding, 2, good attachment and effective sucking, 3, frequent feeding, including night feeding, and 4, complete emptying of breast. So understanding of this physiology and implementation of this when it comes to clinical application, and remembering whichever is against these 4 principles, which includes delayed initiation, prelacteal feeding, incomplete or ineffective attachment, incorrect positioning, and introduction of prelacteal or bottle feeding, is all going to hinder the success of the prolactin reflex, is very, very important. Likewise, we know that oxytocin is important for milk ejection, and this is in turn stimulated by thinking lovingly of the baby, the mother's confidence, as well as the sound and sight of the baby. So this again is going to get inhibited by any worry, stress, pain, and doubt. And this is something which needs to be borne in mind whenever we are talking to the mother. Remove her anxiety, remove her doubt whether she'll be able to successfully breastfeeding. If she's in pain, try to engage with your obstetrician or with the nurses and try to give her effective analgesia, which is something she deserves, and remove any other stress that may be there, which may hinder with oxytocin. Remember to reinforce the key points of successful positioning as well as successful attachment. And I shall not be running into these very, very common things which we keep repeatedly discussing in rounds, but do remember these are simple but very, very important factors for the successful establishment of breastfeeding, and these have to be systematically assessed during every postnatal round. Now, very often we do remember, and we do also see that almost 50 to 60% of mothers in the first 2 to 3 days have some of the common problems that may interfere with the success of breastfeeding, including flat or inverted nipple, sore nipples, and engorgement. So a thorough knowledge of the entire team in order to redress some of these problems is again important. So when there is inverted nipple, remember that the treatment should only begin after birth. And we all know how to teach mothers to grasp the breast tissue and to gently roll the nipple so that it forms a gentle teat. And we also know the syringe technique and the double syringing technique, which is followed routinely only for pulling out the inverted nipple and not for expression of milk. Now, sore nipples, another common problem, is usually because of incorrect attachment, and one has to take every effort to correct the baby's positioning, attachment, examine the baby for any evidence of candidiasis, and remind the mother not to frequently wash the breast with soap and to start applying hind milk. Now, the other common problem, as Vinoda discussed, is engorgement, and this is often due to delayed or infrequent breastfeeding. And the treatment includes providing analgesics to relieve pain, applying warm packs, and encouraging frequent expression of breast milk. Not enough milk, although commonly reported, is usually a perceived problem, and the common causes include short, hurried feeding, infrequent night feeding or night feeding stopped very early, poor sucking position, and engorgement itself leading ultimately to inadequate milk. Now, all this can be relieved step by step by putting the baby on the breast frequently, enhancing mother's confidence, and enforcing correct steps of attachment, back massaging, and relaxation. And if none of these maneuvers help, you may resort to the use of galactobox. Now, quickly, let me also cover the steps for enhancing breast milk feeding in the NICUs. Again, when we have looked into a number of quality improvement initiatives for improving human milk-based feeding in the babies in the NICUs, the combination of various interventions, starting from having posters and leaflets on counseling, again, reinforcing all mothers, families of preterm babies about the importance of early expression of breast milk, kangaroo mother care, non-nutritive sucking protocols, and involvement of the family are some of the interventions that have been found to enhance the success of breast milk feeding in the babies who are admitted into the NICUs. This is the poster from the KMC network and the AIMS, which speaks about the steps of manual expression of breast milk. And it is very important for all NICUs to develop their own quality indicators on the success of human milk feeding. So one must systematically record the proportion of infants who ever received human milk, the average daily dose of human milk given between days 1 to 14 and days 1 to 28, or the average daily dose of human milk across the NICU hospitalization, proportion of feedings from human milk, which is percentage of human milk versus total enteral feeding given, percentage of feeding, again, days 1 to 28, percentage of feeding from human milk throughout the NICU stay, total number of NICU days of any human milk feeding, and total number of NICU days of exclusive human milk feeding. So remember, human milk may denote both the mother's own milk as well as donor human milk, but when you specifically talk of mother's own milk, the benefits are of course immense. Now, it always helps for mothers who are feeding babies in the NICUs to maintain milk diaries such as this, where they may wish to record, whether they visited the nursery, whether they did kangaroo care, how many hours of kangaroo care they performed, whether the baby had drops of milk at all, and whether the baby took feeding directly from the breast. Now, developmentally supportive practices of providing skin-to-skin contact have been well tested, have been well documented, even in sick babies who are on respiratory support and who are on invasive ventilation. And it has been found that early initiation of skin-to-skin contact between mothers and babies in the NICU also goes a long way in boosting the mother's confidence, and having a non-nutritive sucking protocol also helps in improving the proportion of breast milk fed in babies who are in NICU. So I would like to thank the forum for giving me this wonderful opportunity, and I would like to just conclude by telling that breastfeeding is not only the responsibility of the mother, but it is the combined responsibility and resolve of the entire team, the family, as well as the healthcare professionals. Thank you, and over to all of you.
Vijay Kumar sir, you're around. Ankita, you can start the screen share.
Ankita, sister.
So good evening, sir.
Yeah, start, Amma.
Yes, sir. So good evening, sir. Firstly, I would like to thank the whole the management, the IAP Twin Cities, the PATS, the TNAI, and the eminent faculty, whoever was present here, for giving me the opportunity to talk on human milk banking. Here, as we go on further, we'll be looking into the aspects like what is the need for human milk banking, what exactly is human milk bank, and what role it plays both in hospital setting as well as in community, and also what are the possible hazards which we may come across with the human milk bank. It is not that now that we are mainly focusing on breast milk or breastfeeding. It is from the ancient time onwards that breast milk or breastfeeding has been one of the most important aspect into the newborn and mother's life. Like one of our ancient physicians, like Shushruta ma'am, who has very well quoted that one just cannot compare even water of 7 seas with mother's milk, which is nothing but water ensuring optimum growth, nutrition, and healthy life of 100 years. So as we all know, breast milk and breastfeeding are the tailor-made for the newborn, as it improves the overall health and well-being of the woman and the newborn as well, as and it also optimizes the long-term growth of the child, as well as it has economic benefits to the society by reducing the formula milk usage. The role of human milk bank, or the babies who are the breast milk babies who are not able to breastfeed, in some difficult scenarios, where we can see is if the mother is if it is a preterm baby who has been delivered less than 34 weeks or less than 1.5 kg, or if it is a sick neonate admitted in NICU, or if the mother herself is sick and is unable to breastfeed a child or even to express the mother her own milk. And also some of the contraindications, although it is very few, where the breastfeeding is not possible. And unfortunately, the other aspect is maternal death, wherein in these times where we have noticed that during this COVID time, where the mother and baby separation has been taken place in some of the scenarios. In this case, because of these factors, most of the time it happens that the babies or the infants are exposed to formula feeding, and because of lack of access to breast milk, the infants are more vulnerable to develop infections, or there is more increased mortality rates. The babies grow malnourished, and also if the baby is admitted, the hospital stay increases, and also there will be poor growth and development in the neonates. So the first and most important from the beginning that we have all the eminent faculty has been continuously enforcing on is the mother's own milk or breastfeeding. So the first and foremost thing which we all need to emphasize is on the mother's own milk. If the baby is not able to breastfeed, if the mother is not able to breastfeed, so the best alternative is for the expression of mother milk. So the mom, that is mother's own milk, is the first option. The next option where the mother's own milk is not available is for the human milk bank or the donor human milk bank. So when it is a mother's own milk, it is whether it can be a preterm baby or a term baby. In both of the case scenarios, if and any of the ways the mother is not able to feed a child, or if the baby is not able to get mother's milk, then the donor human milk comes into play. So WHO, UNICEF together has put up this, taken a resolution saying that where it is not possible for the biological mother to breastfeed her child, the first alternative available thing is the human milk bank. So a human milk bank should be available in appropriate situations. So what is human milk bank? Human milk bank is a service which is established for the purpose of collecting, screening, processing by pasteurizing, as well as donating the milk for the newborn child to meet the specific medical needs of the baby. So the first human milk bank was opened in 1909 in Vienna. The concept of human milk bank first originated way back during the ages, where it was known as wet nursing. Wet nursing is a concept where the mothers who are unable to feed their own babies, the wet nurses used to come in place here. They used to feed the other babies, but due to the scare of HIV when the milk bank opened, and during this wet nursing, there was certain drawbacks for milk banks. There came the objectives which was formulated, and then in India the first human milk bank was put up, that is by Dr. Armida Fernandez in Mumbai. Currently in India there are around 50 to 80 milk bank, both in private and public sectors. So how does a human milk bank or the donor milk bank operate? So here it receives milk from the lactating mothers, the mothers who are done with their child feeding, and if they feel that if the milk output is excess, they express the milk, they donate. And before this, the mothers are screened for all the health problems, and if there's any communicable diseases. And this is generally a voluntary process. And after, once they express the milk, the milk storage process starts. So this is how the milk bank functions. As I said, firstly, the mothers who are voluntarily donating, even for the donation also, the mothers generally will be taken a consent that whether we're willing for donation, and then the mothers are screened for all the health problems or any communicable diseases or any other health issues. And then a proper dedicated area for expression of breast milk is provided. They can either express manually, that is by hand expression, or else with the provision of breast pumps. And then this milk will be expressed in sterile containers. The containers will be sterilized in the hot air oven. And then once the mother expresses the milk, it is stored in the refrigerator for 24 to 48 hours. And then it can be taken in if the milk is sufficient for that day's feeding, the milk can be stored. It need not be pasteurized. But if the milk is excess, more than 48 hours it is crossing, then the pasteurization process takes place here. The pasteurization is done with shaker water bath method with a temperature appropriate of 63 degrees for up to 30 minutes. And once this pasteurization is done, the milk from these containers are taken and sent for the bacterial screening for the cultures. And once till the culture reports are awaited, we keep these containers into the deep freezer, into the freezer with a temperature of minus 20 degrees centigrade. And once the culture report comes, depending upon whether it is positive or negative, the milk will be thereby transferred into the main milk bank, which is also with a set temperature of minus 20 degrees. And here the milk will be can be stored up to 6 months. And whenever there is a need, depending upon the baby's medical condition, depending upon the severity, the milk is being taken from the milk bank, and then it is being thawed into the room temperature, and required amount or desired amount is being fed to the baby. And one more important thing I would like to highlight here is whenever the milk is which is stored again should not be kept back into the freezer. So what the best thing what we can do here is after thawing the milk, whatever desired amount is there which is required for the baby, only that much amount of milk can be warmed and then can be fed to the baby. The human milk bank is not only for the donor mother's milk, but it also acts importantly on the mother's own milk. As I previously said, if the mother is voluntarily ready to donate, or if the mother who is expressing the quantity of milk is more than what the baby is what baby is taking, then the mother can be kept, the mother's milk can be kept in the refrigerator for 24 hours. And then if this milk is used within 24 hours, then well and good. But if it is not used within 24 hours, then this can be stored into the deep freeze. And then if the mother's milk can also be pasteurized and then will be stored into the milk bank. If the mother desires, we can give that particular mother's milk for that particular baby. So the role of human milk banking in hospital settings are those who are need, the babies who are in need. What are the benefits that we can see? So the donor milk bank is generally for prematurity or very low birth weight babies, wherein we can see that the use of donor milk, the use of human milk or donor mother's milk will reduce risk of developing NEC, infections, and also it reduces the mortality, thereby improving the growth and development of the child. It also benefits, previously as we have discussed, the duration of the hospital stay, and also it reduces the cost of care. Here comes how as a healthcare provider, as a neonatal nurse, or as the whole neonatal team, it is our responsibility to look into the aspect of how we are able to approach the mother and the newborn so that the mother is able to give her milk to the baby. So the first thing comes here is the facilitation of milk expression. As I've said, that it can be either done manually by hand expression, or even by manual breast pumps or electric breast pump. And the main important thing here is the facilitation of both mother and child interaction. So it is that whenever as such the baby is separated from the mother because the baby is in NICU state, but we should never stop the mother in visiting her child. It facilitates the milk output all the more. So the interaction, the bonding of the baby and the mother will thereby improve the milk output of the mother. And also it is very essential for supporting and education of both the mother as well as we healthcare providers. So it is one of the quality initiative program which has been conducted by one of our doctors for improvement of mother's own milk for very low birth weight babies, and till the babies are discharged from the hospital, and the milk output has been increased in our unit from 50 to 80%. So the very critical point here is, as we have discussed, it is the facility how we provide for the expression, how we guide the mother, how do we educate the mother, both for expression of hand milk expression, or with the help of electric breast pumps. So we can teach the mother how to manually express the milk, and as well as the use of electric pumps. So the role of human milk banks in community settings, the first thing is it always enhances the awareness of breastfeeding. The Government of India has put up the national guidelines on lactation management in public health facilities. That is to make breast milk universally available for all infants, and also to improve the breast milk or the breastfeeding awareness or the output, to scale up the lactation management centers for promotion of breastfeeding, kangaroo mother care, and donor milk for all the newborn care units and delivery centers across the country. So it is that it is overall the responsibility of everybody, right from the antenatal period till the baby receives the mother's own milk or the donor human milk. So here the breastfeeding counseling during the antenatal care, then the early initiation of breastfeeding, right from, as Madam rightly said, skin to skin contact improves the early initiation breastfeeding rates, and also the overall the lactation support, the KMC, everything comes into picture here, and then the donor milk, as and when required, will be given. Into the community setting, so the comprehensive lactation management centers into the higher centers of the medical departments, that is to any of the medical colleges, will be active here. So here the donor milk collection, storage, processing, and dispensing for the sick babies will be taking place. Whereas in a smaller units, the lactation management units for collecting and storing of breast milk will be playing their role. And into that, this is very essential that the lactation support units should be present or should be available at all the delivery points to the mothers. So the potential hazards which can be associated with the human milk banking is, we should ensure that we maintain a non-commercial activity, let it not get commercialized. But every newborn or every child receives the mother's own milk or the donor human milk fairly. The donor human milk can be given only when it is medically indicated. So as far as possible, we try to encourage the mother's own milk by either expression through various ways. If in case the lactation is still not sustained or still not established, then the donor human milk bank or the donor human milk is medically indicated. Before the donor human milk or the donor milk is given to the baby, a proper consent from the donors and as well as the recipient should be taken. And also it is the need for cost-effective techniques, as pasteurization process itself is costly. So it's a need for cost-effective techniques of pasteurization should be considered. Very essential or very important aspect is proper documentation and audit should be done periodically, so that this will not get this will not lead to any sort of misuse, or as the first point indicates, for non-commercial activity. And also we should ensure the quality and safety right from collection, pasteurization, and storage. At any part of this cycle, if anything goes wrong, this can lead to infection thereby. Larry Noble, who has very well said that we can now envision a future where the overwhelming majority of high-risk preterm infants will receive the low-tech but very powerful intervention of an exclusive diet of mother or the donor milk. To conclude, milk banks, as we all know, serves as a very important aspect, as a vital function for providing human milk for premature babies as well as any sick neonate who for variety of reasons are or would otherwise have not access to human milk, as human milk confers major protective effects to premature infants. The availability of human milk is an important quality of care issue. So as far as possible, mother's own milk, and then the second important is the human milk, because it has all the protective enzymes which helps the to baby to fight against the infection and also for the better growth and development of the child. And human milk bank improves overall the breastfeeding awareness, and also it plays an essential part of the essential newborn care. Thank you. Thank you, sir.
I think Dr. Krishna, Dr. Sri Krishna, Yadayas, stop sharing your screen.
Yes, sir.
Yeah, Dr. Yadaya could not make it to the meeting. He is in a place where there is no internet. Shall we proceed, sir?
If that's the case, Vijay Kumar sir, because you are handling the session, request you to briefly in about 2 to 3 minutes just sum up the importance of kangaroo mother care to improve breastfeeding. I know it's a different entity. In fact, it's a treatment modality. But how can KMC improve breastfeeding? And then you can go on to the next session. Just a small brief on it.
Yes, and I think we'll discuss that in the panel also. You are also there in that.
Sure.
Kangaroo mother care. People know there international conferences happen for kangaroo mother care, and kangaroo mother care and breastfeeding are very supportive. Kangaroo mother care, we thought it is only for small babies and babies who are admitted at discharge. There is only one point I would be telling about kangaroo mother care to all the people who are here. Please, in your discharge cards of SNCU and NICU, write kangaroo mother care as explained, or what you have done as a treatment number 1, and then other things, the drops and other things. I think we'll discuss that in more in the panel, sir. We'll move on to the next session. We said this is an international nurses webinar. To make it international, really, Dr. Anita Mittal has come. Dr. Anita Mittal and also Dr. Shatarupa Banerjee, both are from UK. Anita is a consultant pediatrician and neonatal lead, and she is clinical examiner and champion, mentoring champion. She is also a fellow RCPCH, and she also has a teammate, Dr. Shatarupa Banerjee, senior specialty trainee in pediatrics at East of London Deanery, and she is interested in newborn care, that too a family-centered care. All the time we are thinking that India is everything is fine with breastfeeding, and Western is totally a different one. But things are changing very much. For this, I request Anita Mittal to talk on facilitating breastfeeding in NICUs, experience from United Kingdom. Dr. Anita?
Yeah, thank you for inviting us to give the talk. And me and my colleagues are here, and we'll talk about the facilitating breastfeeding in neonatal intensive care, our perspective. Yeah, we'll start sharing the slides, and Shatarupa will do the talk.
I also have our ex-nursing in charge, Dr. Sister Carol Warden, with us. So she'll be sharing her experience and some valuable tips on how to facilitate breastfeeding in neonatal unit.
Yeah.
So I'll start now.
Yes.
Share screen. How do I do that?
Yeah.
Can't go to the next. So we are all aware of the advantage of breastfeeding. We've heard since the beginning of this seminar about the advantages of breastfeeding. So I'll just summarize it quickly in a slide. The World Health Organization recommends exclusive breastfeeding until an infant is at least 6 months of age, and with the introduction of solid food around the same time. The benefits to the infant include a reduction in the incidence and severity of infections, asthma, and atopic diseases. And benefits to the mother include reduced rate of breast and ovarian cancer, reduced incidence of obesity, and many others. So the UNICEF UK has some guidance for breastfeeding in the neonatal units. There are 3 different stages. Stage 1 is building a firm foundation. Stage 2 is an educated workforce. And stage 3 is the parents' experience of neonatal units. So going back to the first stage, so building a firm foundation, what that involves is to have written policies and guidelines to support the standards, to plan an educational program that will allow the staff working in the neonatal unit to implement the standards according to their role, to have processes for implementing, auditing, and evaluating the standards that have been set. And last but not the least, to ensure that there is no promotion of breast milk substitutes, including bottles, teats, or dummies, in any part of the facility by any of the staff. Obviously, an educated workforce goes hand in hand with successful establishment of breastfeeding in NICU. So to educate the staff to implement the standards according to their roles and the service that they provide. The parents' experience of neonatal units, I'd elaborate on this, especially because this has a vital role in successful breastfeeding in babies who are not well and who require admission in NICU. So it involves supporting parents to have a close and loving relationship with the baby, enable babies to receive breast milk and to breastfeed whenever possible, and most importantly, value the parents as partners in care. When I say to value parents as partners in care, I think our goal should be to empower parents so that they feel that they are a vital part of their baby's care, rather than just being a visitor who is not as important as the nursing staff and the doctors who are looking after their baby's well-being. So they should be taken as a partner in the care of their baby rather than just a visitor. We know from experience that because of the stress that parents are under, it is unlikely that they will be able to absorb all the information in one go because their baby is unwell. So therefore, they may not be able to grasp what you give them as information. So to be sensitive, to be compassionate, and to keep reiterating the importance of breastfeeding at various stages by various healthcare professionals who have a role in the care of their baby. Skin contact, again, I cannot emphasize more on the importance of skin contact that needs to be recognized as part of essential care, and it is a desirable and it is not a desirable add-on if there is time and resources and staff available. So irrespective of what staff you have and what time commitments the staff have, you have to encourage skin contact. That's a beautiful picture of a kangaroo care being provided to a preterm baby who's on respiratory support. This baby's on CPAP, and you can see the bonding that's already been established between the mum and the baby, and that will go a long way in establishing breastfeeding. So skin-to-skin contacts has many benefits to parents and babies. When mothers and babies spend lots of time together in this way, with the baby's head close to mother's breast, these instinctive pre-feeding behaviors are encouraged in the baby. Mother's milk is the best. We all know that. And to facilitate that understanding in parents, a discussion with them should take place about the value of breastfeeding as early as possible. Ideally, antenatally, mother's own breast milk is always the first choice of feed, except in certain scenarios, very rare, on very few occasions. For example, if mom is undergoing chemotherapy or she's has got HIV infection. Mothers are unable to express milk as soon as possible, ideally in the first 2 hours, and we must do everything possible to facilitate that. Encouraging mothers to express between 8 and 10 times in 24 hours at least once, if not twice, including at night. And evidence suggests that approximately 750 mils or more by day 10 of breast milk is an indicator of ongoing good milk supply. And to do that, we must encourage expressing as often as possible. This is again a beautiful picture of a baby on CPAP latching so well onto the breast. So we could have such images to encourage mothers that how we can facilitate breastfeeding even in the sick newborn. And staff trained to provide with positioning and recognizing effective feeding. At the same time, providing privacy and unhurried environment as mothers learn to breastfeed. I think breastfeeding is a learning curve, so you have to be patient, give mothers the privacy and help them grow. Again, there are certain scenarios where unfortunately we cannot start breastfeeding, where you have extreme preterm birth or very unwell baby who's ventilated. In those scenarios, breast milk is an excellent thing for mouth care. So it's used for mouth care and it tempts the baby to feed. The antibacterial properties of breast milk combined with the familiar taste, it says that evidence shows that babies appear to recognize their own mother's milk. It provides comfort to babies, it stimulates enzyme release, and it's an excellent way to keep the baby's mouth clean. And even when babies not, even when babies not tolerating feeds, using breast
Dr. Sri Krishna. Are you here, Dr. Sri Krishna? Dr. Sri Krishna, sir.
Yes, sir.
I think, is there any net problem, connection problem? No? Benward, is there any connection problem, sir? Madam?
Yeah, I think I can't find Dr. Anita.
Yes, yes,
so,
yes.
Yeah, she just joined back.
Yeah, Chatupajasri. Sorry, we've just lost connection here. Apologies.
Yeah, please
just
go ahead.
To get back. Do you want to talk this and we can? Yeah. I just have to. Oh gosh, update. Yeah, just do the talk first. Wait. Just go back to the slides. Okay. Yeah. Did you flip your camera? Just flip the. No, flip the camera. Flip the camera. Yeah, here we go. It's gone. It's gone again? 1 minute. Yeah. I don't know if they can see. I don't think that. Just
yeah, Anita, we can see. Yes. Yeah, you can just go ahead. Yes, please.
Okay. So where there's difficulties in expressing,
mothers should be provided with additional support, and for that it's important. Sorry. Okay. What's happening? Yeah. So we identify staff who have particular interest in infant feeding, and we enable these staff to access extra training to gain skills in supporting mothers. We should work with the maternity infant feeding lead to develop a system where mothers with particular challenges are referred to their team. So baby-friendly hospital initiative, we are all aware of this. So it's important that we adhere to the code of the BFHI, this where we do not advertise breast milk substitutes, bottles, teats, or dummies. All facilities working towards baby-friendly standards are required to adhere to the International Code of Marketing of Breast Milk Substitute, and staff education is vital, including for medical staff where to access unbiased and evidence-based information on formula milks. I'd like to talk a little bit about our East of England network pathway about feeding. So how we risk stratify babies into high risk, moderate risk, and standard risk. So the high risk babies are the ones as below. So any baby less than a kilo at birth, less than 28 weeks gestation, critically unwell babies, so those that are unstable or hypertensive or ventilated, babies that are on re-establishments of feeds following NEC or a gut surgery, babies who've suffered perinatal hypoxic event and have had significant organ dysfunction following the event, and absent or reversed end-diastolic flow in infants who are less than 34 weeks. They form under the high risk. There are a few other babies who we should be cautious about which category we stratify them and how we advance their feeding. These are severe small for gestational age babies, preterm small for gestational age, babies who've required endomethacin or ibuprofen for PDA, babies who have complex congenital heart disease, those who are needing dexamethasone or steroid treatment, and polycythemic infants. So I'll go back to the previous slide. So these are the high risk babies. The moderate risks are babies between 28 to 32 weeks of gestation, and the standard risks are babies who are born at more than 32 weeks gestation. So for the ones that are more than 32 weeks at birth, you start with 30 to 60 mils per kilo per day of feeds on the first day, and you advance 3 hourly, and you advance feeds by 30 mils per kilo every day. And you continue increasing at this rate until you get full enteral volumes. For moderate risk, you start at the same amount, but you do 2 hourly feeds instead of 3, and you increase by the same 30 mils per kilo, 2 hourly feeds instead of 3, and you continue increasing. For the high risk, you start with trophic feeds of 20 per kilo, 2 hourly feeds, and you increase by 20 every 1 to 2 hours. And you continue doing that till you reach a maximum of 180. And increasing beyond 180 is again discretionary based on the baby's assessment of growth. And babies can move across risk categories based on the clinical assessment. So it's a day-to-day assessment rather than just doing it at birth and then following the same curve. I already discussed about these. And now coming to what milk we choose. So obviously fresh maternal breast milk is the first choice of milk for all babies unless clearly contraindicated. And again, there are very few contraindications. Infants who are born at more than 34 weeks start with fresh breast milk or EBM feeds, and we build it up to 165 mils per kilo per day. It can be increased to a maximum of 200 if there are issues with weight gain. And term formula should be used only if there is insufficient express breast milk available. And that's why it's important to stress on expressing if there are difficulties in establishing breastfeeding, because that way you are still providing breast milk to the baby rather than giving formula. Infants that are born at less than 34 weeks gestation, the ones that are more than 2 kilos at birth, they basically follow the same pathway as infants at more than 34 weeks. If they're less than 2 kilos at birth, then you increase feeds with EBM up to 150. And beyond 150, if they're less than if they were less than 1.5 kilos at birth, you consider adding breast milk fortifiers. So there are two different breast milk fortifiers that we use here, and based on what we use, we decide on what's the maximum amount of milk that you can give them. If you're using a NutriPrem breast milk fortifier, you can give up to 165 mils per kilo, whereas if you're using an SMA breast milk fortifier, you can only advance up to 150, because that then provides the calorie and the protein that's needed. If the baby weighed more than 1.5 kilos at birth and is less than 34 weeks, and you have achieved 150 mils per kilo per day of EBM, then you can increase it up to 180 if the baby tolerates. And in these babies, you consider a fortifier only if there is poor tolerance to increased volumes, or there's poor weight gain, or baby's urea is less than 2, or baby's IUGR that is less than 9 centile. In all of these scenarios, if the express breast milk is insufficient or you do not have EBM, then you can use donor breast milk where it is available, or preterm formula. So as you can see, the formula is obviously the last choice, and you strive to provide breast milk, whether direct breast milk or express milk or donor breast milk. Now, nutrient-enriched post-discharge formula should only be considered for infants who are born at less than 34 weeks, less than 2 kilos, either just prior to discharge or when they're more than 2 kilos, under only certain categories, when they, the proven increased energy requirements, like they're going on home oxygen, have chronic lung disease, and in spite of the providing with fortifiers and stuff, the baby is not gaining weight and is dropping more than 2 centiles during neonatal stay. So very rare scenarios where you need these. Coming to the breastfeeding statistics, so the National Neonatal Audit Program data suggests that babies on mother's milk at discharge from neonatal unit was 58%. And in our area, in the East of England network, the average is 60%. So nearly the national, slightly over the national average. The breastfeeding initiation rate in India in UK on an average nationally is 81%. However, it drops significantly by 6 months of age. So we do have a lot of work to do during the first 6 months in establishing successful breastfeeding. And I'll hand over to Dr. Mittal to just close the presentation.
Thank you, and we apologize for the technical difficulties we encountered. This is not normal we encounter, but today our internet and broadband has crashed few times. So we are just using the cellular data on the phone to do this second part. Sorry. And if we have few minutes, our nurse she can talk about the practical tips on the neonatal unit, how to facilitate breastfeeding, especially when the babies are like unwell, on CPAP, receiving respiratory support, ventilated. How do we facilitate? She can say a few points before we finish. Yeah.
So really the most important thing before you even start is good relationships with your maternity colleagues. You need to really have really good buy-in from them to make this work. Early expressing, that's where you also need your maternity colleagues. You want to make that early expressing as easy as possible for mums. So packs available for them to be able to express ideally within 2 hours. Reinforcing that actually it doesn't matter how much mum expresses initially. Any milk she expresses, 0.1, 0.2 of a ml, can be used for her baby. And encouraging actually mum to do the mouth care with that milk rather than the nursing staff doing it. Very practical things like expressing at the cot side. That can be in an intensive care room, that can be in an open cot, it doesn't matter. That mum seeing her baby will make all the difference. Availability of either hand pumps or electric pumps will also help. As said by other colleagues, kangaroo care, skin to skin, all these things will help mum with her expressing. And really, 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 that mum needs open access to her baby. She should be able to come anytime she likes. Facilities that when she's at home, she's got easy storage facilities for her breast milk, something to bring it in, something to store it in. All those little things make such a difference. But mum at a cot side, expressing, touching her baby, having the baby out for kangaroo care, skin to skin care, just little licks at the breast, that sort of thing before the baby's able to actually fully suck. Absolutely brilliant. Any questions for anybody?
Any questions for us?
I think Dr. Anita, whether all these changes are in 2020 or how they were in say 2010 or 2000, maybe 20 years back, 10 years back.
10 years back. I think it's in progressive changes and facilitation. I think quite a few of the changes have been there from a long period of time in UK, like facilitation of expressing breast milk and having the mothers next to the cot side. And because mother needs a visual of her sick baby, even if the baby is ventilated on inotropes, has got umbilical lines, that shouldn't stop the mother being with the baby, touching the baby, and expressing within screens around the mother, and they express around the baby. They touch the baby, they hold the baby. I think that's what is a success for the establishing breastfeeding and having a lot of breast milk for the babies who are very sick in intensive care units. And that changes the prognosis, that changes the outcomes, and especially the mother's input. Mothers are allowed anytime, 24/7, in all our neonatal intensive care units.
Is this the community acceptance, or there's a lot of effort from the health department there?
I think it's a lot of education to the mothers, which starts from the antenatal visits. The mothers are like, we have a start rate of initiation of breastfeeding in UK of 80.
Them, sir. Sir, okay, 1 minute wait cheddam, sir. Then we'll proceed to the next thing, sir.
Yeah,
they are there. She's there. She has to unmute herself. Dr. Anita, you should unmute yourself. Please unmute.
Dr. Anita, unmute.
Yeah, now we are unmuted. Yeah, sorry. I think, yeah. Sorry, I think the technology is failing us fully today. Even the phones are failing us today. It never happens though. This is the first time we're experiencing.
It can happen anywhere. So just a proof for those in India, technology is the same everywhere. Breastfeeding is the same.
I know, we are part of India only anyways, you know. So this is one of our bad days.
Across any country.
Yeah, it doesn't matter.
Thank you, Dr. Anita. I think it's a wonderful session and very nice to see insights. The science is the same, breastfeeding science stays the same. The issues are probably different, and each of us faces different issues and have to come up with solutions. Sometimes even in the same city, what Dr. Usharani faces is different from what I do. But the intent stays the same, and our efforts have to be tailored so that we are able to address that local issues. Wonderful session. I hand it over to Dr. Vijay Kumar for the panel discussion. Take it away.
Yes. Dr. Anita, thank you very much. Please stay back for the panel, maybe 1 or 2 questions, contextual.
Okay,
please
thank
stay
you.
back. Yeah. And the next session we'll go is before the e-poster presentation, which is by there's a lot of response for this e-poster presentation. It is for all the doctors to stay and see. We'll go for the panel discussion on the theme, sharing the responsibility for breastfeeding. For this, we have the panelists, Professor Rajeshwari. Rajeshwari madam is, she is nurse, educationist, she is in public life, whatnot. She is MSc and PhD. She has more than 33 years of experience in this, and presently she is Dean of the CARE Foundation. She is President, Trained Nurse Association of India. She is also member of Nursing Council of Telangana State Nursing and Midwifery. She was a contestant for the MLC graduate constituency, and she is one of our panelists today. And we have Dr. Sarala Devi. She is the Superintendent, Government Maternity Hospital, Ammakonda. She has been really done very, very dynamic work during this COVID epidemic. In periphery, as Sri Krishna sir said, in periphery, the problems are different, and She is there to discuss us on how she shares her responsibility. And we have Dr. Usha Rani Madam. She is Professor and HOD, Nilofer Hospital. We know she has worked a lot in the Neonatology Forum of India. She has conducted many trainings very successfully. And of course, we have our own Dr. Sri Krishna, the UNICEF consultant and the secretary of TCB, and Dr. Anita. So our topic for the panel is sharing responsibility. My first question, Dr. Rajeshwari Madam. Dr. Rajeshwari Madam, you have...
Vijay Kumar sir, just before you start, Dr. Sarla, I can't find her in the panel.
Sarla Madam?
Oh. Yeah, Dr. Sarla, if you could please raise your hand, then I can unmute.
Sarla Madam? Sarla Madam, you are in? She is in actually.
Dr. Sarla, you could raise hand. It's easier for us to identify you in case you're logged in as a different. Yeah, take a minute. While we have the panel started in a couple of minutes, request to all the nurses to please stay back. We have a wonderful e-poster presentation. We've had more than 50 posters which have come, and it was a tough task to choose just a couple of them for presentation and then to select the top 3. We also have very interesting prizes for the top 3. So request you to please stay back. And there'll also be a registration link which will be sent at the end of the session. And those who have submitted their details in that link, they can download this e-certificate directly. So please stay back till the end of the session. Vijay Kumar sir, please unmute.
Yes, sir. Madam is joining. Madam is joining, sir.
Yeah.
Shall we proceed?
Yeah. Please go ahead.
Yes, Rajeshwari Madam.
Yes, sir.
In your long career, how do you see now? This is as a teacher or as an administrative head, you have worked in almost all major hospitals and public side and in the private hospitals. How do you see how these breastfeeding things have changed?
Yes. First of all, good afternoon to everyone, and I thank IPA, Twin Cities, and PATS and UNICEF for giving me this opportunity. Like when we in the olden days, when I was, studying, and before that also in the past, many mothers used to discard colostrum and they considered it to be harmful to the child, and they gave babies cow's milk, water, and honey during this initial and very important period for the establishment of lactation. But maybe this is because there was no lactation counselors or no nurse midwives teaching about birth preparedness to the mothers. If I take my own example, I was also, to be frank, I had no breast milk, and my
mother and other people tried a lot, but it was failure. So, I mean, if there is a proper teaching for the mothers about the importance and how to go on, I think the preparedness is very much important. And that was not there in the olden previous days. And we nurses, as I believe that we present for 24 hours along with the mothers, both, I mean, all together, antenatal, internatal, natal, and postnatal period. I feel that we nurses play a very important role in supporting breastfeeding. And it's necessary for nurses and midwives to communicate about the new evidences or new research work, what is going on with the pregnant mothers and about the breastfeeding, the importance of breastfeeding that has to be taught to the mothers. And nurses and midwives should keep up with the latest evidence, education and training courses for themselves. They have to, like, pertaining to breastfeeding, they have to have some knowledge. Those days, like when I was staff nurse, those period, we were not having that much scope. If we are working in hospital, we used to work, take care of the patient care. But there is the scope now for the nurses, whichever field they want, they can select. They can go as a lactational counselor or a lactational nurse, or like breastfeeding, banking in charge, wherever they want. She can go and develop herself. That scope is there now, but it was not there in the previous days. As an educator, I feel that there is tremendous change in the healthcare delivery system as it is, mainly concentrating on promotive and preventive services, then curative services. In olden days, we are only concentrating on curative services, but now we are going with promotive and preventive services. By this, we are concentrating more on health education at every stage to empower mothers with knowledge and benefits of breastfeeding. Coming to nursing, we don't have, like as I told, we don't have the scope at all. But now there is a number of ways where whichever way we want to select, wherever we want to work, there is an independence to select also. And this about the breastfeeding, like mothers has every right to decide and to take a decision to go for breastfeeding or not. But still, we nurses, if we teach them properly, we explain them properly about the physiology of breastfeeding, about the importance of breastfeeding, about the advantages of breastfeeding for both mother and baby, I think that will help in enhancing the breastfeeding for a longer time. I think I have answered your question, sir. Thank you very much for giving me this opportunity.
Dr. Usharani, madam.
Sir.
Madam, again, you again deal with many nurses and many nurses trainings. You see pediatric PGs, many women now, obstetrician PGs. And how do you see? How can we share the responsibility? We know that things are not really good. How do you share the responsibility?
Yes, actually, as a teaching faculty for postgraduates and also nurses, actually what I feel is for students, nutrition is a boring topic usually. It used to be. And even as postgraduates, as a postgraduate myself, regarding breastfeeding only, we learned the science of breastfeeding. But art of breastfeeding was never taught to us. The skills, how to promote lactation were never taught to us in those days. But fortunately, things are changing. We learned, we attended the IVSF trainings and learned the art of feeding, art of promoting breastfeeding, how to impart the skills. We learned mostly as a teaching faculty. When I was assistant professor at Gandhi, I had learned most of the feeding techniques only at that time, because as a PG, we were taught only what are the advantages, and only theory part we read, but we never learned the practical aspects. So I can say we are definitely better empowered, and we can impart better knowledge to PGs. Students always, their only focus is exam and exam. 90% of the students, they want to read what is important for the exam, and they want to read only cases which are put in the practical examination. So far, the system is for postgraduate especially, because we are in the teaching faculty where we teach most of the postgraduates as well as undergraduate. The long case is always a CNS case, either a cerebral palsy or a hemiplegia. So they would focus only on that. But what we are doing off late is, because rheumatic heart disease, CP, we won't be dealing with after becoming practitioners or once we come into practice. What we have to deal with day to day is nutritional assessment, promoting breastfeeding. So to create interest, what we do in every case during every case taking session, we focus on nutritional history. And what interests them is, suppose only if we teach only advantages, it is boring for them. So it is how a fussy baby, suppose if there is a fussy baby who is refusing to feed, where there's poor attachment, we show them practically how good positioning and attachment can make difference and how satisfied the baby would be after correcting the position and attachment. That create interest in them. Similarly, what I've noticed in cases of lactation failure, even after a gap of 15-20 days after the mother stops feeding, if we teach them practically how to use relactation by drip drop method or by supplementary suckling technique, when we have shown practically and after few days, once the successful lactation starts, really PGs get interested and they continue to learn these techniques. So that's what I have saw, and also we have to show them practically how improvement in the breastfeeding rates on a larger scale. How can they, how can they add to the improving survival in the country? If you show them in the figures, then that will create interest. So that kind of teaching should be there instead of teaching monotonously only stock cases like hemiplegias or CP. So we have to focus on, as teachers, we should focus on imparting skills on breastfeeding to postgraduates, which will create interest in them.
But actually, in the competency-based medical education, now there are about 18 or 20 competencies exclusively on breastfeeding. What we taught in IM and CI, they are for the postgraduates, madam. Thank you.
I know that to come, probably it will take time over years, probably after 5 years, 6 years down the lane, all skill assessments will get incorporated into the teaching system.
Yes. Dr. Sarala madam, you are in, I have seen. Dr. Sarala madam? Dr. Sarala madam?
Sir, can you able to see?
Yes, I'm seeing, madam. Yes. Madam, we are actually in the panel discussion. Please, as the administrative head, what are your plans in your hospital has about 4,500 deliveries per year, no, madam?
Yes, sir.
As administrative, not as a teacher, what are all the steps you are taking and how are you sharing your responsibility to promote breastfeeding and protect breastfeeding?
Sir, as an administrator, we have appointed two counselors in the antenatal OP, sir. Two counselors at the postnatal, sir. In the antenatal period, the counselors give the how to prepare for delivery and when to start breastfeeding. And they also examine tell the patient to how to prepare the breast. Recently, the retracted nipples, if they are having or any crack, they will teach how to clean and how to maintain the cleanliness of the breast. Immediately after delivery also, in the postnatal ward, the counselors also available. Not only that, sir, we have taught during the Dakshta training to all our staff nurses and our doctors how to give the breast milk. So immediately after delivery, we will keep the baby on the mother chest, sir. Not only that, in the postnatal ward and labor room, sir, we have provided the privacy to the patients. With that, they can give the breastfeeding without any hesitation, sir. Every day we are conducting. Okay, sir. Every day we are conducting a counseling to the patient and the patient birth companion along with the husband. Our pediatricians counseling, sir.
Thank you, madam. Dr. Sri Krishna, sir. Dr. Sri Krishna? Yes, sir. As UNICEF person, you have seen in and out of diverse groups. How do you see the breastfeeding problem? There are problems. How do you see the problems? The problems are the same or they are different for different areas? How do you see that, sir?
Yeah, I think it's a different perspective which UNICEF has and also as compared to the rest of you. We're trying to do justice. We're trying to restore normalcy. And when we try to understand the problem, we always look at where that bottleneck is. The problem for breastfeeding always has been that you have an alternative. When you find an easy alternative, Secondly, if you're not convinced that what you need to do should be done, then you will always go for the alternative. So the first way to solve this deadlock is to ensure that you understand the subject well, the science behind it, the need of it, and the importance of breastfeeding. And sometimes this message has only been as an information, not really as a convincing argument to make a change. So we call it as a behavior change. We find it even around us in COVID pandemic. Wearing a mask, everybody knows that is information. When you start wearing it and follow it as a routine, that is a behavior change. Breastfeeding has not gone to the extent of a behavior change. And this can happen only through champions. Champions in the healthcare, amongst the parents, in the society. You need these champions to be identified and informed to everyone. That is when the first change happens. Secondly, you need a medium in which you can solve issues. It is very easy for us to say you feed the baby only mother's milk. But then the mother on the third and fourth day finds a baby who's crying at night at 1:30. You need a way in which you have to address this. If you do not support this mother at 1:30 in the night for her crying child, the first top feed comes in. And we all know once that happens, it's like the downslide. Things will automatically be going back to the top feed each time the cry happens. So you need a support system. And this is exactly why this year's theme of shared responsibility is so important. It is not the mother who is feeding, it is the family, it is the society, it is us all together who are responsible for breastfeeding. The earlier concept that it is mother's job and you support the mother has to change. It is the family. The child has come into your family, your society, your community. So all of us have a part to play, and no more should we start putting the mother in front and then we hide behind her trying to support. When this change happens in our mindset, that is when we all approach the problem and each one has a part to play. And the last one, when I said about an alternative, this alternative comes into picture just when it really matters. The IMS Act needs to be strengthened, also implemented. We all know that this act is in place since a long time, but it's all about implementing it and ensuring that you follow all the principles so that the mother really does not have to depend on alternatives even the first or the second time. Once she starts falling back on a sound, good health system, which is supportive of her when she needs it, which makes her behavior change, and on top of it, an act that can be effectively implemented, then a big change happens. And it was so heartening to hear from Usha Rani madam, and this is not really what even I learned as a postgraduate. Even when I was a PG 10 years back, it was all hemiplegia, cerebral palsy, ASD, VSD. It's only when I joined UNICEF that I started to understand why this is most important. And somehow this took a lot of time to change at the national level to come up as core competencies in the medical curriculum. Very good days ahead, and I'm sure this will pave the way for a much better indices in breastfeeding.
Yes, sir. Dr. Anita, you are in? Dr. Anita? Dr. Anita?
Yeah, I'm there.
Yeah, Ahmed. In UK, the community participation and the healthcare staff supporting them versus the regulation, the so-called IMS Act, which has dominated, which is really more important or has influence in improving the breastfeeding practices in UK.
So sorry, sir. What was the second part of your question? IMSA. What was it?
The infant milk substitute, the regulatory, some regulatory rules that WHO has said are in UK.
Okay.
Yeah.
So in UK, the system is how it works is we have, so most of the antenatal care is provided not by the obstetricians, but by the team called midwives. So each antenatal visit, so it's like a mixed system where the medical team, the midwifery team, health visitor play an important role in breastfeeding support. So each antenatal visit, which is initiated by the community midwives, we have community midwives who initiate the process of antenatal visits at home or in the clinics. They are the people who at each and every opportunity discuss about the breastfeeding sessions, and they have breastfeeding focus groups as well. And again, they've main focus on breastfeeding is on the families who are vulnerable, like young mothers, socioeconomic down status, or who they feel they have not got enough support system. So that's the way it starts. And then once the babies are born in the hospital, before they are going home, they ensure that the latching and the breastfeeding is established before they go home.
And we have a community, very strong community system, wherein the community midwives visits each family on day 3, day 6, and day 10, the community midwives, and they make sure that the breastfeeding is going well, the baby is gaining weight, they're not jaundiced. So the community system is really very strong in supporting the breastfeeding as well. And if they land into any problems, then they have a system of like calling us, taking advice and doing things. Some of the things which we have felt is if the mothers are so insistent on breastfeeding and we feel that they need a little bit of a top up because they're losing excessive weight, and they'll be reluctant because the breastfeeding has been so ingrained into their mind with repeated sessions. So antenatal counseling is a very strong, and I think that leads to a very high initiation rate. Where we fail in UK is continuation of the breastfeeding at 6 to 8 weeks and 6 months. The rates are very poor, and we are on the bottom of the list in European countries, I think, with the breastfeeding at 6 months. Which is shame because we have a very high initiation rate of 81% of starting breastfeeding.
Yeah, thank you, Dr. Dr. Sarala, madam, during the COVID pandemic, there were deliveries and sections happening only in your hospital, in the entire Warangal. And how did you support breastfeeding during this time?
During this time, sir, we advise the mother to wear the mask strictly and giving the breastfeeding. After that, the keeping the child 6 feet away from the mother. Once the mother became negative, we advised as the normal.
HIV, even HIV mothers, you have quite good number of HIV mothers with you. They are how do you?
HIV mothers also, there is no contraindication for the breastfeeding, sir. We
Madam,
advise the
breastfeeding.
breastfeeding.
Yes.
We advise breastfeeding. So otherwise, the baby may get with the bottle feeding or the top feeding, they may get GIT infections more, sir. That is the reason why we advise exclusively breastfeeding for the HIV mothers also.
Thank you, madam. Dr. Usha, madam. Dr. Usha, madam, are you in?
Hi.
Madam, please tell about the IMS Act and how effective it is. Is it going to help at all?
Yeah, definitely. Actually, studies have actually the survey of the analysis of the data has shown that India has the robust infant milk substitutes. Actually, this regulatory act is better implemented in India compared to other countries. So recently, I was reading an article wherein they were showing there has been a huge surge in sale of formula feeds in China. Up to ranging up to billions of rupees. The infant milk formula industry is amounting to billions in China. But whereas in India, it has been static in somewhere around 500 million, and which has not increased. Fortunately, this industry, though our birth cohort is increasing, our population is increasing, the sales of infant milk formulas is not increasing. It has been almost static for last 5 to 6 years. And the implementation, the IMS Act has been passed in 1992 and has been and was MD, and it prohibits advertisement of any infant milk formulas in any form. And also the formula making industry, they are not supposed to sponsor any events of the doctors or healthcare professionals, and they should not have any pictures of baby and mother on their products, and they should not sponsor any doctors, or they should not organize any events. Actually, the governments as well as BPNA, that is Breastfeeding Promotion Network of India, is also authorized to look after all these, and they can complain and they can even penalize the doctors who are violating the rules, or they can penalize the companies who are violating these rules. Fortunately, it is being compared to other countries. This act is well implemented in India compared to all other countries. Even in our hospital, we don't allow any of the formula or baby food manufacturers, whether it is milk powder or a complementary food manufacturer. We don't allow any of them to meet our patients. So because this is again a violation of the law. So, and we don't allow for any distribution of the samples of infant milk substitutes to any of our patients. And we don't take sponsorships for our programs. Usually we have 3 common programs every week. We take sponsorship from other companies, but we never take sponsorships from any infant food manufacturers. And also we should not allow them to have their displays of any products in our hospital. If you look at our walls near milk bank, we have all feeding mothers pictures. We even have a picture of Rami Krishna feeding twins. So
Yes,
to
yes.
encourage the breastfeeding. And also we have pictures of kangaroo mother care and also baby friendly, 10 steps of baby friendly hospital initiative. So we don't encourage any kind of baby food manufacturing. And this is very well implemented. Many of the big conferences were cancelled because BPNA has complained to the government, and though Nestle and Abbott initially they have agreed for sponsoring the conferences, major events were cancelled. So this was really a very healthy event.
Thank you, madam. Rajeshwari, madam. Madam, ఇప్పుడు మనకి ఇక్కడ from the community, the ASHA worker to a staff nurse in a remote A&M and a staff nurse in a remote place to nurses working in tertiary care centers, NICUs. How
Yes, sir.
all nurses speak one language to protect the breastfeeding, Amma?
Yes, sir. See, first of all, like as per this IMS Act, sir, we are not supposed to go for this. There are some prohibitions, advertisements and all. We should not go for the preparation, this one. And we request our nurses not to, refuse to accept or point out any kind of direct or indirect sponsorship from baby food or feeding bottle companies within the hospital where they are working. Like they have to complain or they should refuse if somebody, or if they see something like that, there is an app, BPNI mobile app, there they have to monitor and share the information in that, so that the people will be coming to know what is happening there. And this app is like there is a Satpan Suraksha mobile app that we have to, we have to ask the nurses to upload. It is available in the Play Store, and we have to tell them to take that one. And actually, like we nurses, either it may be an A&M or any nurse who are working in the community or hospital, they have to know what are the reasons for, the good reasons or the great reasons for breastfeeding. Like we have like around 10 reasons, like perfect nutrition, unique bioactive matrix, protection, contains live cellular components, immunoreactive substance and hormones, brain power to child, ready and portable, good for mothers to build special bond and advantage, continue as baby grows, good for planet, easy on budget and species specific. So when we know that the importance of the breastfeeding, it is very easy for us to initiate the early breastfeeding or establishing breastfeeding, and like early and uninterrupted skin to skin contact between mother and infant should be facilitated and encouraged as soon as possible after birth. When we know the importance, only the nurses can teach the mothers. That is very much important. And we have to create and enable the environment where the mothers are there. They should provide the environment to give breastfeeding for the babies. That facility should be available in the working areas, even in the working areas, so that after the maternity leave, they can come and join and they can utilize the services. So administrators has to take up that one, and they have to see that they will provide. And we have so as a nurse's role, we have to share like from pregnancy, delivery, lactation, beyond hospital to community, like obstetrical, neonatal, pediatrics, whatever it is, like as a caregiver or as a counselor, educator, mentor, consultant, administrator, we have to work on, and we have to see to the IMS Act also, the implementation and how it is going on, that we have to see, and we have to remember the skill that mother and baby, like how the breastfeeding, the skill, the act, everything we nurses has to teach the mothers, and see that the mothers will learn the breastfeeding technique and the importance, time, and they will improve their breastfeeding longevity.
Yes. Ani.
And like I have one small pledge, sir. I want Sri Krishna sir to share that one. I share to him. Sri Krishna sir.
Madam, I don't have it now. Perhaps after the poster, I'll put it up separately so that you can put it up in your closing remarks.
Sri Krishna sir, one question to Dr. Sarala, and then last one to you. Dr. Sarala madam, Dr. Sarala madam. Madam, you are running a very good SNCU. People know it. Even Sri Krishna sir has visited your SNCU. I wanted to know, in the follow-up of 1 year, that follow-up has improved a bit. Follow-up of the SNCU babies. Did you see the breastfeeding rates in them?
Yes, sir. Compared to the previous days, nowadays the breastfeeding days duration is increasing, sir. So previously it is very less, sir. With the increasing counseling and the explaining the advantages and disadvantages of not giving breastfeeding, and what are the advantages to the baby and to the mother by giving the breastfeeding. Nowadays, most of the people are continuing the breastfeeding for longer time, sir.
You call them and you ask them to come for follow-up, no, madam? That is practiced routinely, regularly?
Yes, sir.
Yes.
Every month they will come for the checkup for the obstetric examination, sir. At the same time, we will ask whether you are giving breastfeeding or any top-up feedings. We will definitely ask, and we will encourage them to give the breastfeeding, sir.
Yes, ma'am. Thanks to know. And now I request Dr. Sri Krishna sir to wind up the discussion that we have made in this panel. And I thank all panelists for such a good discussion and a very practical discussion. Dr. Sri Krishna sir, one final comment from you, and then I will hand over to the next session.
It's very important Sarla madam, please go ahead.
Ma'am.
Sir, one question I want to ask Vijay Kumar sir.
Amma.
Sir, Vinoda madam said that the retracted nipple, how to don't use syringe, she said, sir. Nipple shield is available. Sir, nipple shield is available. Can we use it, sir?
No. Big no. No.
Why, sir? For retracted nipple, sir.
I think
there
is an important e-poster session that we'll discuss, madam. Definitely.
Okay, sir.
Dr. Sri Krishna sir.
Yeah. See, everyone has a role to play. It's not mother who has to feed, it's the society. It's all of us who have to together enable this child to survive, thrive, and to reach its complete potential. And it's now that we are recognizing each one's role. Imagine if the government is not very strict on IMS Act. Let's assume me as a pediatrician, I don't bother to talk about breastfeeding. The obstetrician is not looking at the breast in the antenatal examination. The nurse who is conducting the delivery is only bothered about suturing and taking care of the perineum, not putting the child onto the breast. All these are going to harm the mother. And when we say it's a shared responsibility, it's a share across everyone. It's also the media's responsibility. How many times have they promoted breastfeeding beyond the breastfeeding week? We find everybody talking about it now, and after a week, everyone's forgotten about it. Everybody has a part to play. The local leaders, the MLAs, the corporators, the religious leaders, everyone. And our memories are very short. But unfortunately, this problem is something that requires sustained efforts on a daily basis. And if all of us together can put efforts on a regular basis, ensure that every mother gets the required information, the necessary support, and we do our best efforts in our own limitations, then we can ensure that every child is exclusively breastfed, initiated breastfeeding early, and then sustains breastfeeding till 1.5 to 2 years of age. I hope this message is very strong and each one will be able to contribute for the survival and the well-being of every child around us. Thank you, Vijay Kumar sir.
Thank you very much. Sarla madam, to answer right now, actually the baby sucking is the strongest stimulus for breast milk production. And when you are using nipple shield, that itself is a not just physical barrier, it is barrier for everything. So that's why nipple shield should not be there in any pharmacy. It is as a banned one. It is actually banned. The pacifiers, the nipple shields, these are all not a thing that they are available in our country, not available anywhere. I think I'll stop at this point. And again, I thank all the panelists for a lively discussion. Now the next session is the interesting e-poster presentation. For this, I have a word of appreciation, Dr. Vasundhara Tulasi. She has done a very wonderful job in the 12 hours I have given. Actually, I was collecting all the posters so that I can get 2 more, 3 more, 5 more. Then I have given her, she has done a good job on that. Over to Dr. Vasundhara Tulasi, Principal, Apollo College of Nursing, to conduct the e-poster presentation by nurses. Over to Dr. Vasundhara Tulasi.
Good evening, everyone. It's our privilege on behalf of Apollo College of Nursing to conducting the UNICEF, PATS, and IAP TCB. So we all know that it's a great learning when someone is asked to prepare a poster. So poster will motivate us to get more insight about the topic which we are preparing. This is one of the intention for asking many of the nurses and nursing students to participate in post presentation, so that we believe they all would have been prepared with a great understanding of breastfeeding, myths prevailing around it, and especially with the present today's topic. So today's topic. So with this short note, I would like to request Ms. Archana More, who is Associate Professor at Apollo College of Nursing, to lead the session. Over to you, Ms. Archana.
Thank you, madam. It's been my privilege and honor to be invited by you. And namaste one and all. Thank you very much for keeping alive till the end of the day. And it's a great honor for us to collab with esteemed organizations and professional bodies. Given the theme, protect breastfeeding, a shared responsibility, nurses have expressed their views excellently in the form of a poster, in the form of art. So this shows how creative they are, and we all know that art is not an imitation, but it is an illusion. So very few people are creative in putting down their thoughts in the form of art and making us understand what they intend to say us. With a quick note, I would like to take you all to the e-poster session of the day. Before I let you all gaze into the e-poster presentation, I'll share my slide presentation. Is the slide visible? Sorry. One second.
No.
I'm sharing the screen. Okay. Are the slides visible? Can somebody confirm?
Yes, madam. Yes. Yes.
Okay. Thank you, sir. Thank you. So interestingly,
go to
there
full
were
screen.
38.
Go to slideshow or a full screen for the posters.
Okay. Is it okay now?
No, it didn't come for slide share.
Down there is the slide share.
Okay. I think window is shared. Okay. So there were 38 posters that have been received by our esteemed jury. Let me introduce you to the jury of the day. We have our judges, Dr. T. Vasundhara Tulasi, Principal, Apollo College of Nursing, Hyderabad. Dr. Lakshman Kumar, Professor Pediatrics from Pratima Institute of Medical Sciences and former President of PATS. Dr. Sai Kiran, Consultant Neurologist at Fernandez Hospital. So it really took a lot of time for them to evaluate these wonderful posters. And as we all know, the best 5 posters have been selected from these 38 posters. And I will read the code numbers of these. I request the presenters to be ready as I display the code number and the poster to take on and present about the poster. The time will be 2 minutes for each presenter, and I also request the judges to please speak into the time management of the contestants and evaluate 2 best posters out of these best 5. So poster number 1.
Archana, I'll be muting everyone with the setting that they can unmute themselves. So this way, whoever's slide it is, they can always unmute at that particular slide and speak. Okay. Good luck. I'm just changing the setting.
Please slide share, please. Sorry for.
Archana More, try to put it on slideshow. You have the slideshow button on top. So yeah, from beginning. Yeah, you need to unmute yourself. Henceforth, anybody can unmute themselves and speak. Go ahead, Archana. Archana, it's not on. You haven't clicked on from beginning. If you can click on from beginning, it will get into slideshow. It's still not coming up. See if you can click on from current slide. Go to slideshow and from current slide. Yeah, or you can press F5 either, whichever. It usually comes up immediately. All right, I think we'll proceed. Please put up the first slide, and whoever has put up the first slide, you can unmute yourself and speak. Archana, unmute yourself. And you can stay unmuted. Yes, 11A. Who is 11A? Please introduce yourself, and then you can speak about the slide for 2 minutes.
Good evening, sir. Myself, K. Neeraja, studying MSc Nursing second year, Department of Child Health Nursing, Mamata College of Nursing, Khammam. Good evening to all the organizers and speakers. Good evening, one and all. I would like to thank giving this opportunity to present breastfeeding poster. Every year internationally, we are celebrating World Breastfeeding Week, August 1st to 7th. The theme of this year, 2021, Protect Breastfeeding, a Shared Responsibility. The goal of World Breastfeeding Week is to encourage mothers to breastfeed and spread the word about the benefits of breastfeeding. Breast milk as a baby's first vaccine, every drop has a capability to fight diseases. One drop of human breast milk contains more than 1 million white blood cells. Breast milk contains antibodies. It's called as immunoglobulins. Immunoglobulins like IgA, IgG, IgM, IgE, IgD, which protects the baby from acute infections such as diarrhea, pneumonia, ear infections, Haemophilus influenza, meningitis, and urinary tract infection. Breast milk can offer many benefits to the babies. It contains natural nutrients like vitamins, calcium, carbohydrates, proteins, and iron. Breastfeeding is easily digestible and it prevents constipation. It's lower risk of sudden infant death syndrome, and also it improves the intellectual abilities of babies. Mother benefits include, if mother is doing breastfeeding, automatically it will reduce the weight and reduce the risk of breast cancer and lower risk of ovarian cancer. Regarding shared responsibilities, Home care plays a vital role in educating the breastfeeding. Here, husband, mother, grandmothers, relatives, and family members giving teaching about positions, benefits regarding breastfeeding to the lactating mothers. In hospital level, healthcare team members like doctors, nurses are educating, promoting, supporting to the antenatal and postnatal mothers regarding breastfeeding. Moving on community level, ASHA workers and health visitors, Anganwadi workers have the responsibility to identify breast problems, follow up care, and create great awareness regarding importance of breastfeeding to lactating mothers. By all these aspects, we can spread the word, promote, support, and protect breastfeeding and share responsibility to all mothers. Thank you, Om. Thank you, sir.
Judges, any comment, any query, any point to the presenter? Lakshman sir?
Yeah.
Maybe if you have a small question or a query to the presenter.
Yeah, good evening. Good evening to all of you. Good evening to all of you. Thank you all the stakeholders of this the program, the webinar, for giving me this opportunity to give the one of the judges the breastfeeding the posters. So the wonderful the poster it is there. So my question is that this is almost giving all the information which is related to the mother. So, but how do you reach out the rural mass in a better way to increase? Is there any the method to increase the percentage of breastfeeding rural versus urban? So when you will start it?
Yeah.
When you will start it as a nursing care personnel, so what is your role whenever you reach out to the community?
Yeah, the presenter, could you please respond to this? Whatever you know, you say, ma. No issues.
A lot of noise is coming. Please,
Yes,
I request all muted, all should be muted.
Archana, I had to mute you. Please ensure you can mute and unmute yourself. Next one, please go ahead.
Good evening, sir. Good evening, sir.
Yeah, please go ahead, sister. The question is, how do you increase the reach to rural and the urban areas regarding breastfeeding?
Comparing rural mothers having less knowledge, sir, comparing with urban. So, gathering information about rural mothers. They are gathering information from grandparents, sir.
Okay, thank you. So, Archana, I can go to the next slide.
Thank you, sir.
Hello.
Yeah,
Hello.
you need to click on the third slide.
Yeah.
Or perhaps it's already as a slideshow somewhere else, and then it's coming back as a main slide here. You can just keep that slide. It's okay.
Okay, is the second slide visible?
No slide is visible.
No. Wait.
Okay,
Can't see,
first
madam.
one.
Yeah.
Share the screen. Share the screen.
Yes, sir, I have done it, but I really don't know what, sir. Okay, I'm doing it again.
Yeah.
Please give me some time. I'm so sorry. Okay, is the slide visible now?
Yeah, go to the next slide. This was the first presenter. Go to the next slide. Click on the slide.
Second one is code number 15. May I now request the presenter to take over, please?
Archana, you need to click on the slide. Slide number 3.
Please
click on slide number 3.
I have done it. I really don't know.
Yeah, now
what's
it is on.
happening.
Now it is on. Please keep it. Whoever has presented this slide, please go ahead. You have 2 minutes.
Good evening to all. Am I audible, sir?
Yes, go ahead.
Yes, sir. Very much good evening to all of you. So this is Chandralekha from KGNC, Puducherry. So I'm working as a tutor in Puducherry, sir. So I would like to share my heartfelt thanks to the organizers as well as the judges for selecting my e-poster in this international webinar. Thank you so much, sir. So my concept is regarding in the topic itself, we have given that a shared responsibility of breastfeeding. So shared responsibility in the sense, we need to join our hands to share the things to help the mother to breastfeed their child, as well as to help the baby to grow well in the aspect of physical as well as mental, that is growth as well as the development. So we need to support the mother or help the mother to feed their child. In what way we can help the mother to feed the child means, at first I have mentioned that government support. So the government as well as the hospital is having the major role to provide a awareness as well as providing a things to help the mothers to feed their child. So this is the authoritative persons, so they can provide their things to the mothers to feed their child. So as well as they will coordinate with the media. So by media we can develop awareness to the mothers as well as the family members to help the mothers to feed their child. So by that we can achieve 100% breastfed child in the world. So as well as nowadays more women, more mothers are in a working area. So we need to provide a breastfeeding friendly workplace to the mothers. So by that we can achieve 100% breastfed babies. So if the mother is going for a work means the mother is not able to take care of their baby, the bonding will be lacking. So because of that we can start crutches in the workplaces so that the babies can maintain a bonding with their mothers as well as they will get a adequate feed from the mother. So by that we can achieve the 100% breastfeeding, as well as the family support, especially the spouse, the husband has to support the mother as well as help the mothers to breastfeed their babies. So he has to consider that this is not a baby for her, his wife itself. This is a baby for both of us. So he has to help the mother, support the mothers to breastfeed their babies so that they can achieve their benefits of breastfeeding by their children if the children is growing up. Then we need to get a support from a public. In South India, and commonly they need a privacy to feed their child. In South side, they will be having much more shy when they are feeding their babies in a public places. So we need to provide a separate room for breastfeeding babies, lactating mothers in a public places like bus stands, railway stations, etc., etc. So we need to provide a lactation room. By that, the mother can easily move from one place to another place, and they can feed their babies, and the babies can obtain all the benefits from the breastfeeding. So not a single hand can make a sound. So we need to join the hand to save our world with 100% breastfeeded babies. So with this, we can actually, or we can get the benefits of breastfeeding. So the disease-free, infection-free, and the deformity-free world will be achieved when we are joining the hands to support the breastfeeding. So shared responsibility in the sense, not only a single mother is going to share their things to the baby. So we need to coordinate with the mother. We need to support the mother to help the mother to feed their babies. So this is my concept. So with this, I'm completing the thing. So thank you.
Thank you so much, Ma. I request any comments from the jury, please.
Yeah, I'm Dr. Saikren here. Very good poster. I think you put it across the point nicely. Just a quick question. Any idea how you will use media to increase awareness? Anything you can think of innovative?
Yes, sir. By media, we can create more awareness to the public. Nowadays, they are always keep on sticking with the media things only, internet, then Facebook, WhatsApp, Twitter, and all. They will be keep on having touch with that. So by this, we can even this are very much shy to feed their babies. So, am I audible, sir?
Yeah, you're audible.
Yes, sir. So we can share the things in the form of like drama skit or a what to say, actor and actors. So famous persons can share the things. By that, their fans can follow the things. They will advise them. If the husband is watching the things, means they can able to say the things to their wife, their mother, to feed their babies, their sisters. They can share the things to their wife as well as the sisters. What are the benefits of breastfeeding? How we need to give this? So if they are not sharing the things completely, means they can advise the mother to see that particular page or particular website. So likewise, we can create the things.
Yeah, nice. Thank you very much, Chandra.
Thank you, sir.
Thank you, Ma. Thank you, Dr. Saikiran. Now let me take to the third poster. Code number 18.
Good evening to all the dignitaries. Am I audible?
Yes, yes.
I am Saranya, Assistant Professor, Department of Pediatric Nursing from Kasturba Gandhi Nursing College, Sri Balaji Vidyapur, Puducherry. First and foremost,
I'm sorry to interrupt you. I request the participants, please do not reveal your identity. We have given you the codes. Please don't tell your name, institution, anything, please. Thank you.
Okay.
Please carry
on. Okay. First and foremost, I wish to acknowledge my heartfelt thanks to this golden opportunity and my deep sense of gratitude to the organizing committee for this wonderful webinar. Regarding the poster, based on the theme, Protect Breastfeeding, a shared responsibility. The key message here is breastfeeding is not an individual responsibility of the mother alone. I have depicted 4 important supports. Firstly, the family support. Here, I would like to say, along with the mother, the family members should get on board to support the mother physically by providing nutritious food, sleep, and rest. Psychologically, with positive reinforcement, provide her stress-free environment while she's feeding. This support should be for every child a mother delivers, not only for the first child. The family members should be facilitator to listen and understand the mother's need and problem while feeding. And secondly, support in workplace and in public. Nursing in public is a very good initiative by the government that has really alleviated most embracing situation of mother when a baby cries for milk in the public. This also promote comfort and peace to the mother that especially enhance more breast milk production. Here, I would also like to quote maternity benefit for working women according to the Maternity Benefit Act that has helped for exclusive breastfeeding up to 6 months. That is a very important global strategy to enhance breastfeeding. And thirdly, support by health team members. The health team members play an essential role, especially the health team workers in the rural area who educate and prepares the mother in the rural and tribal area and the family to promote the breastfeeding from the antenatal period. They are also key players for establishing global strategies of breastfeeding. by concentrating on the individual and the family, by creating awareness through health education and mass awareness by utilizing the media and clarifying the doubt, especially in this pandemic situation, myths regarding the breastfeeding. And fourthly, the support from the national and international organization. The national and international organization are the mastermind for the protection, promotion, and support for the breastfeeding globally, I can say. And these organizations act as a network and connect all the health sectors closely to benefit the public. They are also doing tremendous work to support the breastfeeding, knowing the fact that breastfeeding is not only gives a healthy life at the younger age, and also it is linked to the higher IQ and the social and in the later age, and good social behavior when the child grows into an adult and adolescent and an adult. This is what I have depicted in the right half of the poster. And thus I conclude with the key fact that by WHO that every infant and child has a right to good nutrition according to the Convention on the Rights of Child. Breastfeeding is one of the most effective ways to ensure child health survival. And yes, no doubt the rate of breastfeeding among the mothers have to be a great extent, but still we have to go a long way to achieve our target to the maximum. So it is a shared responsibility of the individual, family, community, healthcare system, and the national and international organization. Let us join hands as a member of health team members to protect, promote, and support breastfeeding. Thank you.
Lakshman Kumar sir, you have a question?
Yeah, a good presentation for your poster. But the thing is that the breastfeeding is, we all know that it is the best for the baby. But the problem is, how will you convince a mother who underwent the cesarean section or some illnesses? How will you convince the grandparents and the family? How will you convince to enhance the first ever breastfeeding, which is very, very important for the future of the country?
Sir, we can convince the mother and the family by showing them live experience. We can show some other mothers who have underwent this LSES or who are having some chronic illnesses and difficulties. We can show them as an example if they have fed the baby, given breast milk exclusively to 6 months, and also they have continued the breastfeeding for 2 years of age. By showing live examples, we can convince them.
Yeah, thank you. Thank you, sir. The next poster is code number 18. Code number 18. I invite the presenter to take over, please.
Sachina, code number 18 only.
18 is over, madam.
Over.
18 is over. Next slide.
Code number 36B.
Yeah, 36.
Can you please? You have, I think, it's correct.
36B.
36B.
36B, cheppandi.
Okay.
And if you're comfortable in Telugu, Telugulo cheppandi. No issue on the language. I'm sure Lakshman sir will agree.
No problem.
Telugulo cheppalante Telugulo cheppandi.
Sir, is my voice audible, sir?
Yes, Amma.
Yes.
Good evening, everyone gathered here. First of all, I convey my heartfelt thanks for selecting my poster for the final presentation. International Breastfeeding Week is celebrated every year in August from 1 to 7. And this year theme for the Breastfeeding Week 2021 is Protect Breastfeeding, a Shared Responsibility. As for the theme, I have drawn my poster. In this poster, I have represented the word protection with lock and chain. It is, we can see down, I have drawn lock and chain for the protection. By giving exclusive breastfeeding, the baby can be protected from various conditions like intestinal and gut infection, ear infection, allergic diseases, childhood leukemia, respiratory tract infection, diabetes, and obesity. And it is a mother's responsibility to give exclusion breastfeeding for the baby to protect the baby. And coming to a shared responsibility, a shared responsibility. I have drawn few people, means in that rounds I have drawn few people. They will play major roles for exclusive breastfeeding. And first, coming to the family members who are there in the family members, they will psychologically support the mother during her breastfeeding. And coming to the hospital and community, in the hospital and community, the nurses plays major roles like educating the mother regarding the early initiation of breastfeeding within 1 hour after delivery. And they will also educate regarding the continuation of breastfeeding up to 2 years of age. And she also explains the techniques, how to feed the baby, techniques and benefits of the breastfeeding also are educated by the nurses in the community and hospital setup. And next one is NGO, non-governmental organizations. All the non-governmental organizations, they will come together and conduct various programs to bring out the awareness regarding the breastfeeding. And coming to the government level, the government has established 6 months maternity leave for the working women to support the exclusive breastfeeding. And in the occupation, here there is a maternity benefits act where the employer has nursing breaks in order to express the breast milk for nursing child. These nursing breaks are fully paid and available until a child reaches the age of 15 months. If they all collaboratively takes responsibility for exclusion of breastfeeding, we can reach the goal of protecting child and mother from various conditions, and they can live a happy life. According to me, this is my concept, sir. And thank you for giving me great opportunity. Thank you, sir.
Thank you, Ma. I request the comments from jury, please. Sai Kiran sir, Lakshman sir, Vasundhara madam, any questions for the presenter?
Again, just must congratulate for the quality and the content of this presentation to all of you. You have chosen green. I just wanted to tell you that maybe a comment rather than as anything. Breastfeeding has an important aspect on the environment also. So it saves many things. So we talk something as carbon footprint. To generate 1 tin of formula, we consume so much of nature's resources, and then rest of the resources like water and everything. So I just, when I was seeing the color, I just got reminded that it is environment friendly also. So at a bigger level, you are serving purpose to the community. Just that.
Yeah, good. Excellent. Yeah, that is.
Thank you, sir.
I learned a new thing, Dr. Sai Kiran. I didn't know this benefit. So next time, if I'm asked to write and make a presentation, I'll add this point and give this credit.
Yeah, it's at a bigger level. You're contributing to the people are now conscious. So it's something is solid.
Wonderful, wonderful insight.
Thank you, sir.
Next slide. Next poster.
Yes, sir. Contestant number 37, the 5th poster. Contestant number 37, please take over the presentation.
Good evening, one and all. Am I audible?
Yes.
Go ahead.
A very good evening to all the respected dignitaries. I would like to extend my thanks for giving me such a wonderful opportunity to share my poster on this platform. Well, as you all know and understand the importance of breastfeeding, I too just want to share my views on this. As the theme goes like protect breastfeeding and shared responsibility. Yes, it is important to feed a baby with the breast milk as it provides a baby to enhance emotional bonding with the mother and the child. Yes, not just sharing nourishment but also love and the warmth. And provide adequate growth and development and protects against several infections like infections, respiratory tract infections, gut infections, and intestinal tissue damage, and also sudden infant death syndromes and childhood leukemia, and many more. The benefits goes on, and also to improve the high, and also to higher the IQ levels, and also to and by encouraging exclusive breastfeeding for at least 6 months is must needed. And yes, it has many benefits to mother as well. It reduces the risk of ovarian and breast cancers, as I mentioned in the poster as well. It helps the mother in loss of uterus bleeding and quicker return to the normal size after the delivery. And the studies proves that breastfeeding prevents the risk of maternal deaths up to 20,000 maternal deaths annually and also 8 lakhs child deaths annually as well. And as the theme states, it is a shared responsibility. Yes, it is not just the responsibility of the mother, it also shares the same responsibility with the husband of the mother and also the family members as well. To overcome all the myths, they must be replaced with the proper truths, and the source of truths will be the healthcare professionals mainly. And as healthcare workers, we play a major role in providing exclusive counseling to the mother and the family and importance of breastfeeding. Though it is the personal choice of the mother to feed a baby or not, but once if you let them understand the benefits of breastfeeding to the child, trust me, no mother would refuse doing it. For to them, the baby's health and future stands first above all. So, as healthcare workers, let us all together take up the responsibility to let the mothers use the mighty gift in a mighty way for a better tomorrow. Thank you so much.
Yeah, congratulations to all the participants. Wonderful posters, a lot of information, lot of the futuristic thoughts are there. Definitely, all the stakeholders will congratulate all the participants and the judges. Please excuse us any the shortcomings from judges because we have to select the one thing from out of 5. But I think all take it to the sportive way. So all are the winners, I think so, because excellent posters are there. The information is very good. The presentation is very good. The content is very good. The way you people have shown it in this Winter International the webinar, I think you are not far beyond the whatever the Western the countries. Congratulations to all of you. Thank you, Sri Krishna, for giving me this and opportunity, and Professor Vijay also, and Vasundhara Madam, because she called me when I was in the OP. So because just now I finished my passport renewal, so immediately I joined at 5 o'clock. Thank you very much. Sri Krishna,
Yes, sir. So I'll wait for the final result from Vasundhara Madam. Request Lakshman Kumar and Sai Kiran to share the results, or whichever way you three have collaborated. Archana, in the meanwhile, till the results come, please take us through some of the very good posters which have come. Judges, you have 2 minutes to convey the results, please. Archana, go ahead.
Yeah, meanwhile, I'll take you to the other posters who are very excellent, almost reached to the approximation. So just we'll have a look. Is the slide visible, Dr. Sri Krishna?
Yes, please. Go ahead.
Okay. So this poster has nicely depicted about the support
No, you need
groups.
to go to the next slide. So try to use the arrows, perhaps.
Yeah, I'm doing that, but okay, I think the slideshow will not catch up with this. Fine. Are the posters changing?
Yeah, now they are. Go ahead.
These posters really depict the artistic skills of nurses. They're very good posters, actually. Some babies also agree. Okay. So let's wait for the judgment.
You give participation certificate to all, Amma?
Yes, sir. I think yes. And
sir,
we'll be giving a special certification of appreciation for presenting the poster to all the 5 presenters. And then we'll be giving Amazon gift vouchers to the top 2.
Yes.
Yes. I think if Archana has finished, I'll request Dr. Vijay Kumar to summarize and then hand it over to Dr. Vasundhara to announce the results. And if we have any of the PATS members here, they could unmute and speak. Dr. Sri Salem, if you're around, you can please unmute and speak.
Dr. Sri Krishna, sorry to interrupt. The feedback link will be shared in the chat box. So I request all the participants to fill the feedback form to receive your e-certificate. Thank you very much, one and all.
Thank you.
I'm just posting the link in the chat box.
Yeah, thank you. Thank you, Dr. RSV. It was amazing. The words are, they are so skillfully they have put on the posters, and looking at their immense knowledge, I think they have put all the things what they wanted to do and what they wanted to convey in poster. It is not an easy job. And nursing staff, I said, they're the backbone of every hospital and healthcare facility. And they are truly the ones who can be close enough to the patients, and they can do a lot of counseling. As Dr. Vijay Kumar sir was saying, they are really, they give a lot of time to the patients and mothers.
We can keep feedback form.
It was conducted very well, and all the participants were excellent. I think one of the judges, Sai Kiran, was saying that it has environmental friendly also. That really tells how the jury thinks in a very meticulous way. I appreciate his finding, and I thank everybody. I'm giving you the opportunity also. We're conducting many programs here too. I think I gotten some idea today, and tomorrow we have a program at a nursing college. I think that will be conveyed, and it gives me a little bit of a motivation also to where I'll catch up the other field, other areas where how to improve the breastfeeding rates. Thank you once again, RSV. Thank you, Dr. Vijay Kumar.
Thank you, Sri Malesh sir, if you can please unmute and speak. Malesh sir.
Malesh very good. In Narayari sir unnara?
They choose none sir. Who is available? Malesh sir, go ahead.
Good evening.
Passport తీసుకొని వెళ్దామని.
Good evening. Very excellent program. All posters are good, but we have to depict some causes of lactation failure in particularly urban areas. That are missing in all posters. In my experience, in urban areas, affluent families are using top feeding because of their some other reasons. But in rural area, it is mainly malnutrition and anemia that is causing lactation failure. So these are some of the points missing in the posters. So thank you, RSV, for giving me this opportunity. And
Thank you, sir. Vijay Kumar sir, I think closing remarks from you. I'm sure the judges should be ready in 2 minutes.
Yes,
6
sir.
o'clock we can close. Go ahead, sir.
Actually, when Sri Krishna, Dr. RSV Sri Krishna sir was planning this program about 7-10 days ago, it was planned for 1.5 days. Then it has come to 2 hours, and then it's a very absorbing 3 hours. Sir, time management, no, it's not a what you call a personally praising each other, but you have become such an expert in time management, Dr. RSV Sri Krishna. So happy. PATS and TCB, you and young Pavan, I think Pavan is here. You, young Pavan, if he is not there, you please convey. This is, I'm thanking my heart. I think we have many good days ahead. There was so much of transfer of knowledge. Everyone was speaking the same, because what we thought, and Malesh sir, in the last what he was saying, he was something like a critical appraisal of his life's experience, and you pick up each person and how to balance the program as such, and how to keep the standard of this thing was very good from all walks of life. Then obstetricians, pediatricians, nurses from very periphery to the tertiary care. Everyone is involved, even administrators Ministry of Health are involved. I am so happy.
I request Lakshman sir to declare results. Results, please.
Yes.
Good evening. Now the results are out. So, but as I said initially, so please do not take into this into the consideration. But everybody has done a wonderful job. It is only narrow, the margin is there. So we have selected 3. That is 36B is with 47.5%, a total of 47.5, and goes for 36B.
Sir, are you there?
First
Lakshman
prize.
sir?
Yeah. Yeah.
I think sir lost connection.
Yeah, sir is here. Sir, first, second, third, వాళ్ళ code marks ఒకసారి చెప్పండి sir.
Yeah. 36B.
Sir is back.
Yeah, 36B. Total. I have to say all total or just total?
లేదు sir, top 3 చెప్పండి మాకు.
Lakshman sir, can you please announce the result?
Yeah,
Madam, sir, చెప్తున్నారు madam. Yeah.
Announcing, yeah. So the first is 36B, that is 14.5, 19, and 14. Total is 47.5. And the second prize is 15. That is the code number. What is this? 15, madam? 15, number 15. Code number 15, 13, 18, 13.5, 44.5. And the code number 18, 13.5, 18, 11.5, 43. So the first is 36B, and 11 is got 39.5, and the other person has got 37.
Who is second, sir?
Sir, who is second?
Second is
15, sir,
code number 15.
Yeah, so we have 2 prizes. So the first prize for 36B and the second prize for 15 will be giving certificate of appreciation separately for the 5 presenters who have presented, a certificate of participation for all the nurses who have put up their posters, I know 50 plus posters, and a certificate of patience for all the 3 judges. So going through patience of facing all this, just imagine what the 48 people will think after seeing this.
Because she has taken a lot of pain and a lot of this one. So we are only the additions. So definitely go you have to give a big the applause to Madam because she has taken, and also the Professor Vijay also, and for Sri Krishna, because Sri Krishna is a wonderful. I always because I can't one thing in COVID for Sri Krishna. He has got a lot of the scientific how to mentor, how to proceed, how to present it. Excellent the Sri Krishna, because wonderful associated with you. Definitely, I learned a lot of things for the last 5 years, because before 5 years I was not knowing you. Maybe I missed a lot of things from you. Thank you.
Thank you, sir. Very kind of you, and thank you all the 3 judges. So the first prize is 36B. You get an Amazon gift voucher worth 1,000 rupees. The second is number 15. You get an Amazon gift voucher of 700 rupees. You will collect it from Dr. Vasundhara Tulsi in 2 days. Madam will get in touch with you and ensure that you get this voucher. Use it well. Use it to buy a book on neonatology or on breastfeeding, and please participate in the further activities by the TNAI chapter and also PATS and IAP TCB. Thank you, everyone. Last comments by Vijay Kumar sir, and then vote of thanks by Dr. Tulsi.
Yes, sir. If you permit me, Dr. R.S. sir, I shall try to give one consolation prize to 11A from my side.
Go ahead, sir. Anything is all right.
11A, I don't grade it as 1, 2, 3. One prize from me for 11A.
So 11A, get in touch with Tulsi madam. She will give you Vijay Kumar sir's number, and
thank you for
allowing me. In case sir gives you a car as a gift, let us know. We'll also prepare a poster next time.
Right. And thank you very much, Vasundhara Tulsi madam. You were doing everything, and I got the credit for doing the e-poster session. And also Archana More, madam. And yes, I thought,
thank you.
yeah. Thanks to Dr. Alimelu madam, Usha madam, Surendranath sir, Pavan, Arjun sir, Rajeshwari madam, then Archana, everyone have done their part really well. I thank all. I thought these programs will go and let us spread to the community, sir, this way. Thanks all.
Thank you, Vijay Kumar sir. Wonderful. And as secretary and person who conceived the idea, it was really easy for me to connect with you. Our relation goes a long way, and on a professional front also, we've been working together, and it was so easy. All I had to do was tell you what needs to be done, and effortlessly it went through. And as promised to Lakshman sir, we started at 5:15, and I gave you that extra half an hour as required. Tulsi madam, over to you for vote of thanks, and we can close.
Right.
Good evening, one and all. I immensely thank the entire organizing team that includes Indian Association of Pediatrics Twin Cities branch, Pediatric Association of Telangana, then UNICEF for supporting Apollo College of Nursing and TNI Telangana to be with you and to disseminate the information which nurses require. In fact, it's a thought-provoking webinar. Though we think that breastfeeding is a simple concept, but many myths are prevailing, many doubts are prevailing with the people. So though health professionals are getting oriented, still when it comes for the experience, they get many doubts. So most of the doubts were being cleared by the experts. I thank each one of them for their expertized opinions, sharing their views. I also thank Dr. Vijay Kumar, who is in touch with me, and I came to know about sir just 3-4 days back. And then he is passionate about doing the work. Then anyhow, my special thanks is always with Krishna sir, who is an inspirational figure for many. And whatever webinar he takes, it just touches people. So God has given him such a talent to touch people with his statements, words, and then his way of expression. It's really extraordinary. So I thank Dr. Lakshman sir and then Sai Kiran sir for being very good, and then for being very open and then cooperative. Then very patiently have asked all of them the questions, thought-provoking questions for the post presentation. I thank my faculty who are there in the OBG department, especially Ms. Archana, who has taken up for moderating. She did her excellent job, and OBG HOD of my college, Dr. Jabila, and her team for supporting me all the way. Whatever we were been planning out, they are there with me. So thank you one and all. I wish that Krishna sir gives us the opportunity to explore like this in the field, and then we can reach out many health professionals in future. Thank you.
I think the shared responsibility is forever. It's never ending. Shared responsibility not for this 2021. It is forever. I think so.
Totally, ma'am. I think we achieve more when we do it together. And this is probably the first time I'm seeing IAP take a lead to conduct a international nurses webinar. It's been always nurses doing for nurses, pediatricians doing for pediatricians. And this time I thought, when you say it's a shared responsibility, it's my responsibility to get nurses along with us. We are together when we work on the field. At Lakshman sir's hospital, at Vijay Kumar sir's hospital, it's the nurses who do the work. Sir, frankly speaking, they're just the face of it. They take the decisions, but the rest of it, all care is all done by nurses. So when we're doing it on field as a team, no reason why we should do separate events. And thank you PLA chapter.
Teachers are the backbone of the education, and nurses are backbone of the healthcare. That is that way it is has to be there. It has to be there forever, not for only a year or 365 days. It is forever. This is my concept. Thank you, Ananda.
Thanks everyone. So for the nurses who have any queries related to your participation certificate, for the 2 winners of the prizes, please get in touch with Madam. Give her the evening off. Get in touch with her tomorrow, and she'll take it forward. And on behalf of PATS and IAP TCB, we're happy to support nurses in such competitions. Thanks everyone, and we'll again catch up at the next session by IAP. Thank you.
Thank you, sir.